adult obesity prevalence at or above 35%. Fast forward to 2023, 23 states had 35% or higher adult obesity rates. According to the CDC, in my home state of Georgia, 35% of adults are obese, and 1 in 10 adults are living with 3 or more chronic conditions. During my time as a pharmacist, I saw firsthand the toll that diet-related chronic diseases can have on individuals and families due to rising health care premiums, out-of-pocket costs, and missed work. The financial impact is astronomical, not to mention how taxing the physical, emotional, and mental burdens can be. Just looking at the impact of diabetes, the United States spends more than $327 billion each year combating the disease, with $237 billion spent on medical costs and another $90 billion in productivity losses. America needs a new prescription, a clear, bold vision for the future. We can no longer afford to simply throw more money at this problem and hope for change. It is time to break from the old ways and embrace innovative, courageous ideas that will truly make America healthy again. I'm looking forward to hearing more about how HHS is working to improve healthcare access for American patients and reduce provider burnout by leading on necessary changes to fix the broken health insurance prior authorization process. I'm also looking forward to hearing more about your agency's plan to reduce unnecessary animal testing. So many of us here today are committed to a more efficient drug development process, and I'm encouraged by the FDA's roadmap to reduce animal testing in preclinical safety studies through the use of innovative 21st century science. As a supporter of the FDA Modernization Act 2.0 and the lead author of the FDA Modernization Act 3.0, I'm excited to see that under your leadership, Mr. Secretary, the Department of Health and Human Services is building off these proposals and leading the charge for the development of safe, effective treatments and therapies without unnecessary animal suffering. I look forward to hearing additional details of the Secretary's proposal and to continuing the dialogue between HHS and the Energy and Commerce Committee as we begin the budget process in earnest. Again, I appreciate you being here today. I look forward to hearing how the proposed HHS budget will advance President Trump's mission of making America healthy again. I now recognize the gentlelady from Colorado, Representative Dingell, for 5 minutes for an opening statement.
Thank you, Mr. Chairman. HHS and its crown jewels, agencies like the NIH and FDA, have championed amazing breakthroughs that until this year have accelerated, making us the undisputed world leader in curing disease. The cancer death rate in the U.S. dropped by 34% from 1991 to 2022. We now have an antiviral that cures Hep C in 95% of the cases. And globally, vaccination has saved 154 million lives since 1974. These achievements were driven by federally funded biomedical research and by public health professionals serving at HHS. Sadly, the Trump administration, beginning with DOJA's shocking and mystifying cuts, is imperiling our health and that of future generations. The department has created chaos by indiscriminately firing new employees, pushing established experts into retirement, and implementing poorly conceived reductions in force. These cuts were done haphazardly and without regard to HHS needs, present or future. In addition to inexplicable, chaotic layoffs, the department has frozen and slashed grants, politicized science, and added bureaucratic red tape. While some work has been reinstated, in large part due to court orders, every member in this room, on both sides of the aisle, has heard from public health organizations and research universities in their districts about the abrupt halting of funding. I don't have time to go over all the important funding cut just at the University of Colorado, but it includes a researcher studying whether and how airborne contaminants, including glyphosate, impact chronic kidney disease, and another looking into whether viral infection accelerates Alzheimer's disease. Research labs are closing. Americans are dying waiting for care. Promising clinical trials are being delayed. And scientific research, which is the lifeblood of our communities, is stopping. I think we all read the article in the Washington Post last week about the Georgia man with metastatic cancer whose treatment in a clinical trial has been delayed because of a lack of essential lab personnel. Thanks to the chaos this administration has caused, his life is on the line. Why make these cuts? It's inexplicable. Many research cancellations appear not to be driven by concerns rooted in science, but in biases completely unrooted in evidence, such as the Secretary's animus towards mRNA technology. He ignores that COVID-19 vaccination prevented 3.2 million deaths in the U.S. between December 2020 and November 2022. Under the Secretary's leadership, the Maha Commission, which met once behind closed doors and conducted an opaque process without public input, released an error-ridden report that misrepresented researchers' work, made up sources, and included AI hallucinated information. In looking at chronic disease and how environmental factors influence it, the Secretary has identified some real problems. Those problems demand rigorous study, and I know I and all my colleagues stand ready to work collectively to address them. But the federal workers who were unceremoniously fired could likely have helped develop a useful and informative report. The Secretary is here today to defend his fiscal year 2026 budget. This budget is a roadmap to continue the chaos of the past several months and a blueprint for a sicker and poorer America. This budget seeks to cut the NIH by 40%. What that means is less NIH-funded research, fewer high-quality studies, and a shrinking base of scientific talent in the United States. NIH-funded research underpinned nearly every single drug approval in the U.S. from 2010 to 2019. In this budget, the Secretary calls for eliminating programs to prevent death and disease, such as the National Diabetes Prevention Program, the Tobacco Prevention Control Program, and, with what you said, Mr. Chairman, the Safe Motherhood and Infant Health Program. This budget would also train fewer healthcare providers even as our population ages. It deeply cuts workforce development programs, including those that place doctors in underserved areas. We need more doctors, not less. I started by talking about our successes. These victories were driven by the very programmers, researchers, and public health professionals this budget seeks to cut. As a result, I fear the U.S. is quickly losing its international position as the leader in public health and biomedical innovation. The decline this budget fuels will cost American jobs, and it will cost American lives. I call on my colleagues on both sides of the aisle and both sides of the Capitol to reject this budget and work together to promote the health and build on our greatest success stories. I yield back.
The gentlelady yields. The chair now recognizes the chairman of the full committee, Chairman Guthrie, for 5 minutes for an opening statement.
Thank you. Thank you, Mr. Secretary, for being here today. Thank you, Chairman Carter, for the time. And I'd like to welcome you to the Energy and Commerce Committee, and it's good to have you with us today. HHS has become the largest spender of our federal departments, and whether at the pharmacy counter, doctor's office, or dinner table, HHS work impacts Americans every single day. The core mission of HHS is to enhance the health and well-being of all Americans, but Americans are increasingly frustrated by a system that has become inefficient and too expensive. That is why President Trump's pledge to make America healthy again resonates with voters across the country. The American people spoke loudly and clearly when they rejected business as usual in November, and already in the first few months of the administration has taken significant strides to challenge the status quo. The budget we'll be discussing today rethinks how HHS accomplishes the mission of enhancing the health and well-being of all Americans. Like many other departments across the federal government, HHS has ballooned over the past 4 years. In fiscal year 24, HHS was responsible for 25% of federal spending. While increasing resources to our health departments might make sense during a once-in-a-lifetime pandemic, using that increase as the new baseline for HHS should not be how it operates. As I've said many times this year, it is the mission of HHS that matters most, not the bureaucracy. If this administration has ideas on how to more effectively and efficiently deliver on the missions Congress has directed HHS to undertake, it is our duty to thoughtfully examine them. This does not mean blindly accepting them, nor does it mean opposing ideas that go against the grain just because they're new. While some of the bigger proposals have consumed headlines, there are countless examples that reflect this administration's mission to modernize. The FDA's recent announcement about harnessing AI to help streamline review and approval processes speaks to this administration's commitment to embracing innovation to greatly benefit the American people. And innovation that's coming. Mr. Secretary, I was in Boston and saw in a little saline bag cells that when implanted into a human produces insulin on demand. And they were saying there's a cure for type 1 diabetes within this decade, or having family members that have suffered with Alzheimer's. There are great strides in Alzheimer's this decade. We want to all work together to make sure we increase this momentum. But I'd also say CMS' recent ACA Marketplace program integrity rule represents the administration dedicating to combating widespread waste, fraud, and abuse plaguing our healthcare system. The rule will save American taxpayers up to $12 billion in 2026 alone and lower patients' premiums by an average of 5%. Fighting the chronic diseases crisis by investing in its root causes, as well as working to strengthen the safety and quality of our nation's food supply, are prime examples of common sense steps that are long overdue. As HHS continues to carry out its vital mission, communication and collaboration with Congress will be essential to ensure lasting success. I am confident that everyone in this room wants to see our healthcare system that is driving us to be the healthiest America we can be, regardless of disagreements on the best way to get there. I would also like to take a moment to thank a personal privilege to welcome my friend Gary Andrus back to the committee. Gary was our staff director when I first joined Energy and Commerce, and congratulate him on his new role as the Assistant Secretary of Health and Human Services. Secretary Kennedy, I look forward to our discussion today. Thank you for being here, and I will yield back.
Will the gentleman yield?
Yield.
I just want to agree. Mr. Andres was the staff member who pretty much dragged 21st Century Cures over the finish line for then Chairman Upton and myself, and we're really happy to see you here, Gary.
Thank you. I yield back.
Gentleman yields. The chair now recognizes the ranking member of the full committee, Mr. Pallone, for 5 minutes for an opening statement.
Thank you, Mr. Chairman, and thank you, Mr. Secretary, for being here. And good to see Gary as well. Congratulations. For the past 6 months, the Trump administration has created chaos within our health system by canceling funding grants, rescinding billions of dollars in obligated funding, firing thousands of civil servants, and eliminating entire agencies and programs within HHS. Today's hearing is important because it finally provides us the opportunity to get some answers from Secretary Kennedy. But for months, we've been demanding answers on the administration's actions that seriously threaten the health and well-being of the American people. And many of these actions have been illegal, but Secretary Kennedy has refused to provide this committee any justifications for his actions, and I find that unacceptable. I express deep concerns with your nomination, Secretary Kennedy, and somehow, unfortunately, you've exceeded my expectations in the worst possible ways. You're actively undermining vaccines, the greatest public health achievement in modern history. Earlier this month, you unilaterally fired all 17 members of the Advisory Committee on Immunization Practices, the medical experts who developed vaccine recommendations, and appointed 8 anti-vaccine people. It's clear that you do not intend to uphold the commitments you made to the Senate during your confirmation process to not take away people's access to vaccines. Instead, I believe you intend to use your position to advance your dangerous pseudoscience agenda and put the lives of Americans, as especially children, at risk. The chaos has not been limited to vaccines. The Trump administration cut nearly $3.8 billion in grants from the National Institutes of Health, creating extreme uncertainty for medical researchers across the country and threatening future medical innovation. Things are so chaotic at NIH that more than 340 of its top scientists signed a letter to the NIH director detailing unprecedented waste, abuse, and illegality at NIH under the Trump administration. And this was an unprecedented action by these employees who must feel they have no other options at this point other than to go public. In addition to widespread grant cancellation, tens of thousands of civil servants have been fired across HHS. And Secretary, you've claimed that these staffing cuts have not interfered with program operations, but we know for a fact that that's not true. Entire offices and centers have been eliminated because there's no staff left to run them. Grantees and stakeholders can't get answers to their basic program questions. Staff at FDA and CDC have been brought back just to keep programs running, and deadlines at FDA are being missed. And these decisions have been made indiscriminately without any regard, in my opinion, for their impact on the health and well-being of the American people. And now, Secretary Kennedy, you've proposed a budget for the upcoming fiscal year that includes drastic and devastating cuts to our health agencies. The administration proposes a 54% cut to the CDC, threatening the agency's ability to protect the health of the American people. It proposes a 20% cut to NIH, which will seriously threaten our ability to conduct medical research into new life-saving treatments and cures. And it proposes an 11% cut to the FDA, decimating our ability to approve safe and effective drugs and medical products and keep our food supply safe. The Secretary has also proposed a reorganization of HHS that would not only eliminate important programs, but entire agencies like SAMHSA. And this action will seriously undermine our ability to continue to make progress against the opioid crisis. And all these actions decimate our public health infrastructure, and they come at the same time that Republicans are pushing their big, ugly bill that would take health care away from 16 million Americans so they can give giant tax breaks to their billionaire friends. The Republican bill is the largest health care cut in American history, ripping health care away from tens of millions of Americans, increasing costs on everyone else, and forcing the closure of hospitals and nursing homes. It'll have dire consequences for our entire healthcare system, and I believe people will die. Now, there's a lot to cover today at this budget hearing, but I just want to say I do believe the Secretary must appear here again very soon for an oversight hearing on the unprecedented and troubling chaos he's created at the vaccine panel and its impacts on people's access to life-saving vaccines. These disturbing actions warrant investigation. I hope Chairman Guthrie will join us in getting answers on behalf of the American people. I have about a half a minute left. Let me just say, I don't say any of these things, Mr. Secretary, out of any, not liking you in some way. And I know I probably shouldn't say this, but, President Kennedy was my hero when I was growing up. RFK, I worked on his campaign before he was assassinated. Joe Kennedy was my friend, had the office next to me when I was first elected. Patrick Kennedy, still a friend. The younger Joe Kennedy was a member of our committee. I thought did a great job. I admire you. I admire your family. I admire your work that you did on the environment. But it's just very upsetting at this point to me. Thank you, Mr. Chairman.
The gentleman yields. This concludes members' opening statements. The chair would like to remind members that pursuant to committee rules, all members' opening statements will be made a part of the record. We want to thank our witness for being here today and taking the time to testify before the subcommittee. Our witness today is, of course, the Honorable Robert F. Kennedy, Jr., Secretary of the U.S. Department of Health and Human Services. Per committee custom, the witness will have the opportunity for a 5-minute opening statement, followed by a round of questions from members. The light on the timer in front of you will turn from green to yellow when you have 1 minute left. I now recognize the Honorable Robert F. Kennedy, Jr. for 5 minutes to give an opening statement.
Thank you, Chairman Carter. And thank you, Vice Chairman Dunn. Thank you, Ranking Member DeGette, and members of the committee. I'm honored to appear before you today to present the Department of Health and Human Services fiscal year budget for 2026. Debilitating disease, contaminated food, toxic environments, addiction, mental illness affect families across every race, class, and political belief. When my team and I took the helm at HHS, we set out with clear goals. First, to make America healthy again with a special focus on ending chronic disease epidemic. Second, we committed to delivering more efficient, responsive, and effective service to over 100 million Americans who rely on Medicare, Medicaid, and other HHS programs. Third, to achieve these goals while cutting costs for taxpayers, we intend to do more, a lot more, with less. The budget I'm presenting today supports these goals and reflects two enduring American values: compassion and responsibility. I invite the committee to unite around these ideals with me. The United States remains the sickest developed nation, and yet we spend $4.5 trillion annually on healthcare, 2 to 3 times more per capita to comparable nations. Clearly, something is structurally wrong with our approach. Furthermore, healthcare costs are steadily increasing at a rate of 2% greater than the economy. This is unsustainable. If we don't staunch this trend, we will ransom our children to bankruptcy, servitude, and disastrous health consequences. Yes, an exploding debt is a social determinant of health. We won't solve this problem by throwing more money at it. We must spend smarter. We will shift funding away from bureaucracy toward direct impact. Some things at HHS will not change. We will preserve the legacy programs like Medicare and Medicaid and the foundation of the MAHA agenda. Vulnerable populations, seniors, and veterans deserve consistent access to care, and I will make sure they receive it. Today, 83 million Americans, urban and rural, lack adequate access to primary care physicians. We will prioritize these families, especially Native Americans and Alaskan communities. We will protect IHS funding, streamline its operations, and give the tribes more autonomy in managing their resources. Let me be clear, we intend to make the Trump HHS not only the most effective, but also the most compassionate in U.S. history. While our official budget statement outlines many priorities, I want to highlight a few. First, we will consolidate programs to better tackle mental health and addiction. These issues now rival chronic disease in their impact. HHS will aggressively combat the opioid crisis, especially the spread of synthetic drugs like fentanyl. We will empower state, local, and tribal leaders to create effective solutions. Second, we will address nutrition, physical activity, and healthy lifestyles. The president's budget requests $94 billion in discretionary funds to support these priorities, including the Administration for a Healthy America. AHA will oversee initiatives such as Prevention Innovation Program, which targets chronic disease and childhood obesity through access to nutrition service and physical activity and reducing dependence on medication. Third, we will equip FDA to expand its food safety efforts through research, regulation, inspection, and education, to remove harmful chemicals from food and packaging and explore how to close the generally recognized as safe with a grass loophole. Fourth, we will fund cutting-edge research at the NIH while cutting risky or non-essential studies. That includes ending gain-of-function experiments and research based upon radical gender ideology. At the CDC, we will return to core missions, tracking diseases, investigating outbreaks, and sustaining public health infrastructure while cutting waste. Fifth, we will eliminate DEI funding and redirect resources toward real poverty reduction. We will move beyond lip service to communities of color and take meaningful action to address their needs. Six, we will strengthen cybersecurity and health IT. The AI revolution has arrived, and we are using this technology already at HHS to manage healthcare data more efficiently, securely, and to increase the speed of drug approvals. Finally, we will rebuild public trust that eroded through the years of industry capture, waste, and misplaced priorities. We will launch a new era of transparency in public service, creating an honest, science-driven HHS that answers to the President, to Congress, and to the American people. I look forward to working with Congress to pursue this mission together as a bipartisan cause. Let's work side by side to make America healthy again. Thank you, Mr. Chairman.
Thank you. The gentleman yields. I thank you for your testimony. I would also like to remind members that they are limited to 5 minutes of questioning. Again, as I stated before, we're going to adhere by that today. We will now begin questioning, and I recognize myself for 5 minutes. Mr. Secretary, our national debt is one of the greatest threats to our country. We all recognize that, and Americans are still reeling from the debilitating effects of the Biden-Harris administration. But rather than address the cause of this uncontrolled spending, the Biden-Harris administration chose to double down. And as a result, we're facing a debt crisis of our own making. The United States is on an unsustainable fiscal path with a gross national debt of $36.2 trillion, equating to over $270,000 per household. If we don't work to bring down our debt and address waste, fraud, and abuse, and it's going to cost Americans dearly, especially in the healthcare space with an aging population. We all recognize that. We can no longer afford to simply throw more money at this problem and hope for change. That's why we look forward to HHS's transformation to make America healthy again. Mr. Secretary, can you explain your vision on how the proposed reorganization can make the department more efficient and effective for patients and providers?
Yes, Mr. Chairman. Our cuts are designed to eliminate waste, fraud, abuse, redundancies, to streamline the department. During the Biden administration, we added 38% to the budget of my agency. And American health indicia, in other words, the health of the American people, actually declined precipitously. So throwing money at it, in 1986, we spent the equivalent in this agency of $250 billion in current dollars. Today, we spend $1.45 trillion just on chronic disease. And we spend, the budget of the agency is a little over $1.7 trillion. And we've gone from 11th in a lifespan in 1986 to 49th today. We are today the sickest country in the world. We have the highest death rate during COVID of any nation on earth. And that's because of our chronic disease epidemic. That's because we had the highest chronic disease burden of any country in the world. Throwing money at this agency has not worked. We need to realign the agency. We need to recalibrate its trajectory so that it transforms our healthcare system from a sick care system into a healthcare system.
Can you elaborate some on how HHS has already taken steps to do just what you described?
Well, first of all, very few of the studies that were being done by NIH were being done on chronic disease. NIH should be telling us what are seed oils doing to our children? What is corn syrup doing to our children? What are food dyes doing to our children? What is the packaging and microplastics doing to our children? What are pesticides doing to our children? None of those studies were being done. The studies that were being done by NIH and many, let me give you an example of the few that I cut. There was a study, a $2.2 million study from Boston University to study the effects of exogenous testosterone therapy on communication in gender-diverse speakers. We got a $3 million study at the University of Pennsylvania that studied anti-vaping social media campaigns targeted towards sexual gender minorities, teens between 13 and 18. We got $1 million from the University of Michigan to study sexual fluidity and longitudinal changes in alcohol misuse. And that's just an example of thousands of studies like that that were doing nothing to improve American health.
Thank you.
And we're going to change that. We're going to have gold standard science. We're going to have replicated studies. We're going to publish our data. We're going to publish our peer review. And we are going to, for the first time in 30 years, return NIH to evidence-based science.
Thank you for that. And Mr. Secretary, I'm going to submit some questions also for you to answer to highlight a couple of kids who are living with ultra-rare mitochondrial disorders like Hope with MLS syndrome and Jackson with Barth syndrome that needs your help in accessing life-saving medications. I know that you are committed to helping with orphan drugs and helping with rare diseases, and I've got some questions about that. Also, if you get a chance later on, I'd like for you to address what was done yesterday with the prior approvals. I think that was very significant, but I'm out of time. At this time, I'm going to yield back and recognize the gentlelady from Colorado, Ranking Member Dingell, for 5 minutes of questioning.
Thank you, Mr. Chairman. Mr. Secretary, members of this subcommittee sent you letters seeking information on February 13th, February 28th, March 13th, March 20th, March 25th, April 1st, April 3rd, April 9th, April 10th, April 11th, April 28th, April 29th, May 28th, June 10th, June 11th, June 17th, June 22nd, and June 23rd, to which we have received no response from your agency whatsoever. Mr. Chairman, I'd like to enter these into the record, please.
Without objection?
Thank you. On June 16th, a federal judge ruled a large swath of NIH grant terminations illegal and void and vacated them, requiring that the grants resume. These grants deal with science that is disfavored by this administration, as we just heard from the witness. Judge William Young, a Reagan appointee, said that the administration's explanations for terminating the grants were, quote, bereft of reasoning virtually in their entirety, end quote. He added, quote, I've sat on this bench now for 40 years, and I've never seen government racial discrimination like this, end quote. Mr. Secretary, I have a yes or no question. Does the department intend to comply with Judge Young's ruling? Yes or no?
I will comply with
Yes
the
or
law.
no, sir?
I'll comply with the law.
Thank you. As reported, in your opening statement, Mr. Secretary, you said that you're committed to reducing bureaucracy. But as reported in the Washington Post on April 17, 2025, HHS imposed a new layer of bureaucratic review by which every disbursement has to go through political appointments at HHS. Hospitals, universities, and community health organizations have told me and the other members lately that funds are stuck at HHS due to this so-called Defend the Spend initiative. I asked you about this in the April 23rd letter over 2 months ago, to which you have not responded, and I'd like some answers. Yes or no? Did HHS conduct a cost-benefit analysis on the Defend the Spend procedures?
I don't know anything about
You don't
that
know,
Washington
okay.
Post article.
In letters, you don't know whether you did a cost-benefit analysis, right?
I don't know. I know that. I don't
Okay.
know anything about that Washington Post article. I
No,
don't
do you
believe
know
it's
anything about the Defend the Spend initiative?
About what?
The Defend the Spend initiative
No.
that your agency has? You don't know about it. Mr. Chairman, I have an article here dated April 17, 2025, about the Defend the Spend initiative. I'd like unanimous consent to enter it into the
Without objection?
Now, in Mr. Secretary, on June 9th, hundreds of NIH scientists sounded the alarm on how this administration has wasted millions of research dollars, injected politics into science, and damaged the public trust. 68 Nobel laureates signed this letter. On June 10th, we sent you a letter. Of course, we haven't gotten a response with our concerns that you or your staff might retaliate against them for telling the truth. So here's my question. Will you commit today that neither you or anyone else at HHS will take any retaliatory action against the brave scientists that work at NIH? This should be
I
an
can
easy
commit
answer because
this.
it's illegal.
I can commit that we are absolutely depoliticizing science at
Will you
NIH for the
commit
first
that
time.
you will not take any
Biden
retaliation?
administration,
Excuse me.
Ms. Chairwoman, the Biden administration politicizes science, and I just
Okay,
gave you,
excuse me,
I just
sir.
gave you 3 of
Excuse
thousands
me,
of
sir.
examples of
Excuse
how
me,
they
sir.
did that.
Excuse me, sir. I asked you a simple question. Will you commit to not taking retaliatory action against the NIH scientists that signed the letter about the research dollars? Yes
I
or
don't
no?
know anything about that letter.
You don't know about the letter?
No, I
Okay.
don't know anything about that letter. This is
Okay,
the
well,
1st
we'll
I've
put
heard
that,
of it.
we already put that, our question in the record. I'd like a response. Now, in my last few minutes, in our letters dated February 28th, April 1st, and May 28th, to which you did not respond, we have some questions about reductions in force. How many HHS employees received RIF notices since you were sworn in?
I think around 10,000.
10,000. Did you personally approve those layoff decisions?
Of each one, I approved of the policy.
Thank you. You approved the policy. Your NIH director, Jay Bhattacharya, told employees, quote, I actually don't have any transparency into how those decisions were made, and I was quite upset about that. It would have been nice to have some say. I guess I'll follow up with more written questions, Mr. Chairman.
Thank you. The gentlelady yields. The chair now recognizes the chairman of the full committee, Chairman Guthrie, for 5 minutes of questioning.
Thank you, Mr. Secretary. Over here on this end. So we talked about the reduction in force. So I'm going to ask you, I'll do 3 questions quick and let you answer. So what is the status of the reduction in force or any potential reorganization? And are you able to discuss the details of this potential action, or does the legal situation limit what you're able to do today? And then what does the path forward look like if the injunction's cleared?
With that issue now, the reduction in force are under litigation. And we're under a court order not to talk about them.
So if the injunction's lifted, the path forward, or can you talk about that as well? So what would happen if the path forward, if the injunction is lifted?
What happened with?
If the injunction is lifted,
Oh,
what
I'm
would the
happy to
path
talk
forward
about
to
it.
look like?
If the injunction is lifted, Congressman, what was the rest of your question?
What would the path forward look like? The path forward.
Well,
What do you see HHS becoming if the injunction is lifted with the reduction in force in place?
the people who are subject to the injunction force are on administrative leave, and they will remain on administrative leave until the injunction is lifted. At that point, we will make decisions, and in some cases, there have been gaps in our ability to perform our duties. I've brought people back. I've brought 722 people back to CDC. I brought 220 people back to NIH because we were not able to perform our job. And I brought 313 people back to NIOSH for the World Trade Center, for the Cleveland office and the Morgantown office. They were doing important work that we did not, that was critical. But the people who have been terminated are people who are involved in administration. There are tremendous redundancies in my department, and I'll just give you a couple of examples of that. We had 9 separate offices for women's health. We had 8 separate offices for minority health. We had 41 chief information officers. We have 1,400 external affairs staff, 40 procurement departments using 4 different contracting systems, 9 human resource departments, 8 finance departments, 40 separate opioid programs, 42 maternal health programs. And so what we tried to do is consolidate those, and the people who were let go were people who were not involved in primary care or in delivery of care. They were redundant administrative offices that have been added to over the past 8 years, and where we've increased staff by 17%. And we were going back to the pre-Biden era levels, and that's what the RIFs are intended to do.
So, and as you saw gaps in some of those decisions, you brought people back to fill the gaps, to complete the mission that you want HHS to do. So so thanks for doing that. So one other question, I only have about a minute and a half left, but one of my biggest priorities over time has been innovation. We talked about Boston and what's going on there with type 1 and Alzheimer's and others. President Trump finalized the Medicare coverage of an innovative technology rule just before the end of his first term. President Biden modified the MCIT rule, but significantly restricted access to the program. And by extension, President Biden's administration restricted access to breakthrough technology. Will CMS modify the Biden administration's policy? And do you have a timeline from when we can expect modifications on MCIT?
We're doing more than probably any other cabinet department to drive AI and new technologies into the healthcare system, into our department. We're using it in every aspect of our health department. You saw my press conference yesterday with Chris Klum. He's a billionaire who's walked away from $1 billion business in Silicon Valley to come and revolutionize AI in our department. We're doing that at every level of our department. We have the best people in the world working for us, and we're going to transform the American health system over the next 4 years and make it the leading health system in the world because of the technology that we're bringing in. And we have the best people working for us. We've been able to recruit and attract people of unprecedented caliber to our agency to facilitate that transformation. And it's one of the things that I'm most excited about.
Thank you. Well, my time just expired, and I appreciate you being here. You're back.
The gentleman yields. The chair now recognizes the ranking member of the full committee, Representative Pallone, for 5 minutes of questioning.
Thank you, Mr. Chairman. Secretary Kennedy, quite frankly, I think you're trying to defend the indefensible. There's no way that this budget or the actions you have taken thus far as Secretary are going to make this country healthier. And you keep talking about waste at the agency, but I mentioned in my opening there are 340 top scientists who signed a letter to the NIH director detailing unprecedented waste, abuse, and illegality at NIH under the Trump administration. And you know, the thing that really disturbs me the most is this anti-science agenda. That I think it's clear to me that the vast majority of scientists and medical professionals, you know, think your views on vaccines are dangerous, are not supported by scientific evidence. I'd like to ask the chairman, I'd like to ask unanimous consent to enter into the record a letter from 63 medical and public health groups and a letter from the American Academy of Family Physicians, American Academy of Pediatrics, American College of Obstetricians and Gynecologists, and the American College of Physicians, all raising grave concerns, Mr. Chairman, about the Secretary's actions to undermine vaccines.
Can you
Without-
tell me the date
without
of that
objection.
letter, Congressman?
No, I'm not asking a question. I have something to ask.
Okay, because I think that letter was sent
I'm just asking
about a
unanimous-
week after I got in
Mr.
here.
Chairman, I haven't gotten my questions. I'm just asking unanimous consent to enter these into the record.
Without objection.
Thank you. The Secretary, Mr. Secretary, the science is not on your side. I just really think that people are going to die as a result of your actions and congressional Republicans' actions. But you keep mentioning transparency during your testimony. You said it over and over again. But you promote, I consider, unfounded and unscientific therapies and conspiracy theories without data or evidence. And all of this has been done behind closed doors without any public engagement, despite your pledge to lead with, I think you called it, radical transparency. So let me ask you about, yes or no, though, about this radical transparency that you say you espouse. Do you believe that keeping Congress informed of your decisions and promptly answering inquiries from members of Congress fits within your promise for radical transparency? Just yes or yes?
Yes.
Okay, thank you. Now, since you became Secretary, I have sent you 10 letters on a variety of topics, including the devastating workforce and program cuts at HHS. You've answered none, and your staff have given no indication that you intend to answer, despite being asked repeatedly. And this, in my opinion, is the opposite of radical transparency. I call it radical obstruction of congressional oversight. So again, yes or no, do you commit to providing a written, substantive response to all questions posed in each of these letters no later than August 1st? And if not, give me a date.
We've gotten an unprecedented number of letters from Congress, literally thousands upon
Okay,
thousands.
but I'm only asking for a date. Can you
and we
answer
are
by
answering
August
them as
1st?
fast as we can, and all those letters will be answered.
I haven't gotten a single answer to any of them, Mr. Secretary.
Well, there, like I said, we have gotten thousands
All right, I'm
and
just
thousands
asking
of
you,
letters from Congress.
you said that you want to be transparent. You've said that Congress in responding to us is important. So can you give me a date? If not, I'm going to assume I'm never going to hear back. I said August 1st. August 15th? Tell me.
I'm not going to tell you a date. Because
Well, then I don't think I'm ever going to get a response, and I think your suggestion that somehow you're being transparent is simply not true. Now, one last question. You have made a number of major decisions about vaccines, and again, there's been no public comment process or public accountability on that either. What are you afraid of? I mean, with regard to vaccines, are you just afraid of receiving public comments on proposals? Or you just think these are fringe views that are contrary to the views of most scientists, and that the public comments will reflect this? You say you want transparency, but there's been no public process for any of this.
we have a
Why?
public process for regulating vaccines. It's called the Subcommittee, and it's a public meeting. There will
You
be public
fired the
comment at that
committee.
meeting.
You fired the
I fired people who had conflicts with the pharmaceutical industry.
Oh, I mean, that's...
That industry, that
Okay.
committee has
there's
been a
been no-
template for medical malpractice
All right,
for
look,
30 years.
I can't, the bottom line is here, we have no transparency, we have no response, you feel no responsibility to Congress whatsoever, and you just continue this ideology that's anti-science, anti-vaccine. That's all I see. I see nothing else, and I don't think I'm ever going to get a response, and so I'm going to have
Will
to
the
ask.
gentleman yield?
My time is
Well,
up.
this is, Mr. Chairman, this is the Committee of
Chairman,
Jurisdiction.
Gentlemen,
like to
the
answer that
gentleman has
question.
yielded. The chair now recognizes the vice chair of the committee, of the subcommittee, for 5 minutes of questioning. Dr. Dunn.
Thank you very much, Mr. Chairman, and thank you, Secretary Kennedy, for being with us today. I want to begin by commending you for the work your department and the administration has done to make improvements in the health of the American people and to be responsible stewards of our tax dollars. Time and time again, we heard from the prior administration mismanagement across the department, but I'm particularly concerned about the damage inflicted to public trust in our health institutions. Unsurprisingly, when faced with sweeping mandates, the American public responded with skepticism and mistrust. I know you've already taken steps to restore public trust in our health institutions. Do you see those as being successful in the near future, or over what timeline?
We're going to restore public trust, Congressman, Vice Chairman, by restoring truth. We're going to tell the truth to the American people, and we're going to use evidence-based science, gold standard science. As I said, we're going to use replication. If I can take a minute just to respond to something that Congressman Pallone said, and I'll address you, Congressman Pallone. 15 years ago, you and I met. You were at that time a champion for people who had suffered injuries from vaccines. You were very adamant about it. You were the leading member of Congress on that issue. Since then, you've accepted $2 million from pharmaceutical companies in contribution, more than any other member of this committee. And your enthusiasm for supporting the old ACIP committee, which was completely rife and pervasive with pharmaceutical conflicts, seems to be an outcome of those contributions.
Mr. Chairman,
Thank you.
point of order. Point of
The
order.
chair
Point
recognizes
of order. The
Dr.
gentleman is impugning the reputation of a member of Congress.
Stop the clock.
Can you stop the clock for a second? Can you state the point of order?
Yeah. He was impugning Mr. Pallone's
Mr.
reputation.
Chairman, I didn't hear it. Did the
Oh,
gentleman?
you weren't paying attention. That's why.
Well, you know, it's hard to pay attention here when we're not getting any responses.
Okay,
My
okay.
understanding now is that the secretary said something about me taking money from pharmaceuticals? Is that what he said?
The secretary implied that Mr. Pallone would not fight for vaccine victims because he took money from the pharmaceutical industry.
You know,
He
again,
needs to take back those words.
you know,
Mr.
he
Okay,
needs to-
okay,
I
here
would
we go,
ask that
here
the
we go,
words
here
be
we go.
taken down.
This, Mr. Secretary, this is a valid point of order, I'm told. So I'd ask you if you would, please take back those words.
They're retracted.
Thank you, Mr. Secretary. Now, ladies and gentlemen, we're going to continue on with the decorum that I mentioned earlier in this hearing. And what we're going to do is to go to Dr. Dunn to finish up his time of questioning. Dr. Dunn is recognized.
Thank you very much, Mr. Chairman. So the department's fiscal year 26 proposed budget includes $750 million for strategic national stockpile as the Republican lead on the Pandemic and All Hazards Preparedness Act, PAPA, we call it. I believe that a strong national stockpile is critical to ensure we're prepared to respond to emergencies. Do you see this stockpile as being adequate, or $750 million budget being adequate for that, sir?
Well, I'm very, very gratified about congressional support for reappropriating PAPA, which is absolutely critical for our pandemic response. The stockpile, I think, has now $17 billion worth of inventory. I have to check those numbers, but I'm pretty sure that that's it. And we could be doing better. The stockpile was did not distinguish itself during COVID. It didn't
No, it
have
did
many of the things that we needed during COVID, and we're doing a review of that right
please
now
let
to
us
make
help you
sure
with
that the
that.
stockpile is adequately stocked.
Keep us informed, and we'll help you with that. Thank you, Mr. Secretary. You've long been an advocate of addressing mitochondrial health, kind of an interesting, edgy area that's illuminated earlier by the questions from Chairman Carter. The Haley VA Medical Center in Tampa has validated the compassionate use data for amyotrophic lateral sclerosis, Parkinson's disease, and has generated new positive data using mitochondrial transplantation for Alzheimer's. They've also entered into formal agreement with Walter Reed to use this experiment with this treatment for traumatic brain injuries. And now NASA is entering into a similar agreement to study mitochondrial health issues associated with space travel. Secretary Kennedy, do you intend to continue these efforts?
To study mitochondrial?
Yes, sir.
Yeah, I mean, that's going to be, mitochondrial dysfunction is the heart and soul of the chronic disease epidemic. And, you know, we now know that Alzheimer's disease, which was once thought to be, have a number of hypotheses about its etiology. But Alzheimer's disease is now characterized in the medical literature as type 3 diabetes, because it's recognized that mitochondrial dysfunction is not just causing disease in children, but it's also causing a disease in adults. And the cause of it is clearly our food. That's one of the principal causes, and we are absolutely laser focused.
I'm afraid our time has expired, but
Gentleman's
thank you
time has
very much for your
expired.
answers.
The chair now recognizes the gentleman from California, Dr. Ruiz, for 5 minutes of questioning.
Thank you, Mr. Chairman. Earlier, Secretary Kennedy, you said you wanted to instill trust using truth, evidence-based, gold standard science. But Mr. Kennedy, in late May, the so-called, quote, Presidential Commission to Make America Healthy Again released what HHS described as a, quote, groundbreaking assessment that purported to identify the key drivers behind childhood chronic disease. Improving the health of America's children is a goal I share, and I recognize this is a passion of yours, Mr. Secretary. That is why I was struck to learn that the report was riddled with mistakes, misconstruing and intentionally or not misstating key references, data, and evidence that either do not exist or are not accurately reflected in the report. When journalists reached out to many of the authors of the studies included in the MAHA assessment, numerous researchers and academics stated that they never wrote the papers as cited, or the papers cited didn't even exist altogether. Mr. Chairman, I want to submit these 3 news reports on these miscited documents from notice from May 29th and May 30th.
Without objection.
Ms. Secretary Kennedy, you're listed as the chair of the commission. Did you read the report and fact-check its sources prior to publication?
All of the factual
Did you read
sources-
the reports, and did you yourself fact-check them, sir?
I did not fact check.
You did not fact-check. So why then, as has
All of
been
the
widely
foundational
reported, excuse me,
assertions
sir, I'm
that-
speaking. Why then did the report include a citation to sources that don't even exist? How does that happen under your leadership, sir?
All of the foundational assertions in that report are accurate.
They did not
Some of them-
exist. How can they be
some-
accurate if they did not
I said
exist, sir?
Some of the citations
You know, in
were-
fact, my understanding
Some of the
is that
citations
even
were
once
messed
the
up for
report,
one day,
even once the
for one-
report was updated, more authors and researchers came forward stating that their research was misconstrued. This is quite unbelievable, sir. In fact, I was a pre-med at UCLA. They have a great pre-med program. If somebody turned this in as an undergrad to their professor at UCLA, they would have received an F, sir, an F for the misinterpretation, the falsehoods, the denials, and also citing references that don't even exist. That's lying and dishonest, sir. My concern here
The citations
my
were
concern
corrected in
here
one
is
day.
that you and this administration are undertaking vast changes to our federal public health system and using purported facts and gold standard evidence that you claim to have as justifications for your decisions, actions, and frankly, your decimation of our nation's public health infrastructure. Yet, what you are relying upon isn't real. It isn't data-driven, and it isn't based in fact, science, or reality. Sir, it's wrong. As the secretary of one of the most consequential departments within our federal government, mischaracterizing data is not just some typos in a report that gets put on a shelf. Instead, your words and your words of your department carry significant weight. Do you agree?
The
Does it carry
citations in that
significant weight?
report were wrong.
The
That was
question-
a mistake. They
the
were
question-
corrected within
and there-
24 hours.
Yeah, but there were wrong still even after that, and they're wrong still today.
There were no
So do you
erroneous
believe that
factual
your
assertions,
words
Congressman.
carry significant weight?
There were no
Do
erroneous
you
factual
believe your words
assertions.
carry significant weight?
There were no
Does
erroneous
the
factual
do you
assertions.
believe that the Secretary of the Department of Health and Human Services plays an important role in upholding scientific integrity?
Yes.
Okay, so then, in fact, what is most striking about this is that you've also threatened to bar governmental scientists and researchers from publishing in top medical journals. You've barred them from publishing in top reputable medical journals and instead proposed, quote, creating our own journals in-house. The idea that we would
want me
limit
to
the
answer that
ability for
question,
federal
Congressman?
researchers to publish in the most preeminent medical journals and instead have HHS just publish more reports like their MAHA failed assessment, lacking the scientific rigor, accuracy, or peer-reviewed criteria that are required by leading journals, should worry us all for the future of medicine and innovation. Sir, you mentioned that building trust was a priority number 7. You have failed already in building that trust. How can we trust you when in your report, under your leadership, when you're the chair of this report, has false information and makes up research that didn't even exist? So, Chairman,
You left me
I
no time to
yield
answer
back
the question.
the remainder of my time.
Gentleman yields. The chair now recognizes the gentleman from Virginia, Mr. Griffith, for 5 minutes of questioning.
Thank you very much, Mr. Chairman. I would remind everybody that Galileo got an F during his day and age, and that sometimes people who are trying to do cutting-edge work don't get the response they expect from this leading scientists of the day. I also would encourage you, Mr. Secretary, to give my Democrat colleagues answers to their questions. But I would note that Chairman Guthrie and I never got answers from SAMHSA that we started asking in April of 2023, and the Biden administration has never gotten us those answers. And at one point, Secretary Becerra took a year to answer questions for the record, and you haven't even been in office that long. So when we go through this process, while I would like to see it quicker, and I do think that both sides of the aisle need to get answers, it takes some time sometimes to get the correct answers so that you don't get accused later of having false answers or getting Fs on those answers. Now I'm going to move to my questions. It's my understanding your proposed reorganization of the agency, the National Institute for Occupational Safety and Health, or NIOSH, may be housed under proposed administration for a Healthy America within HHS. I am supportive of ensuring all agencies under HHS are functioning efficiently, but I would like to emphasize that the Coal Workers Health Surveillance Program within NIOSH is very important for the constituents of my district and across coal country. This program does many things to help detect and mitigate black lung disease by providing black lung screenings, certifying B-reading physicians to analyze black lung from screenings, and uses their resources to help individuals receive black lung benefits. I have many black lung clinics in my district and around the coal country in central Appalachia that serve thousands of coal miners. Will you commit to working with me to ensure that the current benefits NIOSH provides for black lung will not be negatively impacted by any of the reorganizations taking place, and that we will work to continue the important work that they do?
Yes, absolutely. And I've spent a lot of time in Southern Virginia, West Virginia, Eastern Kentucky. I know the importance of these programs, those NIOSH programs, and that's the reason that I reinstated the Morgantown office and the Cleveland office specifically for the reasons that you're talking about. And I
appreciate
can
that.
assure you that this will be a priority for
I
us.
appreciate that. I will say, too, that I heard you talking about pesticides. I'm particularly concerned about neonicotinoids, and I'm also concerned about microplastics, but we've got to do the scientific research so that we're not throwing the baby out with the bathwater, that we actually know what we're talking about. But I do share your concerns in those areas. In your testimony, you mentioned that the budget refocuses the Unaccompanied Alien Children Program on its core mission of sheltering unaccompanied alien children while also protecting them from child trafficking and labor exploitation. I have been very vocal on this issue since I first went to the OOR intake at Fort Bliss a number of years ago. At this location, immigration authorities conducted no collaboration with law enforcement to sufficiently vet sponsors of unaccompanied minor children. We must do and implement real background checks, not just a search on the internet, FBI fingerprinting, and if we can't do live home studies, which would be required, at least in the Commonwealth of Virginia, where I practiced in the domestic arena for a number of years, and if we're not going to do live home studies, let's at least implement a process where we notify the local school divisions or child welfare agencies when a child is placed with a sponsor in their jurisdiction. Because right now, or prior to this administration, they were being just placed and nobody in the local community knew they'd been placed there. So then none of the child welfare agencies or the school systems knew to be looking for that child. And will you work with me to make sure that we improve the system, or if you already have a plan, can you explain it to us?
We already have a system in place for protecting those children.
And because my time is
Biden-
running out, I got one more to get to. If you can just share that with me later, I'd appreciate it.
I can share very briefly right now.
Well, I'm about to run out of time. It's a problem. Chairman will gavel me down. So if you can do that later, that'd be great. I am concerned about FDA embracing flexible authorities that we've given them. You did some stuff yesterday to give flexibility. I'm very concerned about Huntington's. In particular, I have 2 families that I know personally who are afflicted with this disease. I want to make sure that we have a good process of flexibility at the FDA. When there aren't other treatments available, it's worth taking the risk on something new that has some promise and being flexible. Would you agree with that, sir?
Yeah, we are fast tracking. We're expanding the use of compassionate use. We want to get medicines that
Get that medicine out there as fast as we can. I appreciate that. I'm sorry I had to cut you off, but we're all running on time. I yield back.
The gentleman yields. The chair now recognizes the gentlelady from Michigan, Representative Dingell, for 5 minutes of questioning.
Thank you, Mr. Chair. And like many here, Mr. Secretary, I have many questions. I'm going to go to an issue we agree on in a minute. How are we going to lower drug prices? But before I do that, I want to invite you to come to the University of Michigan, which is one of the nation's leading recipients of NIH funding. You mentioned it here, but didn't talk about how much they're driving innovation and keeping the United States at the forefront of biomedical research. Every week that I'm home, I meet with a group of scientists who are doing liver cancer, pancreatic cancer, ovarian cancer, brain cancer, diabetes, burn pits, and mental health. Groundbreaking, that's just frozen. And we're going to lose a generation of researchers. And I want you to hear about their work and how worried about they are, because this country has led for the last decades in innovation and technology, and we cannot lose that. So please, can we work together to make sure the research that has to happen does?
Congressman, I will work absolutely with you. You can call me in my office if you have a study that has been cut. That
I have a lot.
And
So I'm
call
going
me
to.
up, and we'll talk about them, and I'll get you answers on all of them.
Deal, thank you. But now, let's talk about an issue we agree on, which is lowering, how are we going to lower drug prices?
The issue of
Lowering drug prices for American consumers. This is why Democrats work so hard to pass the Inflation Reduction Act and create the Medicare Drug Price Negotiation Program, which provided you, the Secretary, with the authority to negotiate pharmaceutical companies to lower drug prices for the Medicare program. Do you support the drug price negotiation program and commit to using the tools and authorities provided to you under the law to drive down prescription drug costs for the American?
I mean, we're using every tool that's given to us, and President Trump has ordered me to do something that no other president has, which is to establish across the board most favored nations so that we're not paying more than Europeans are. We're in negotiations right now, today, with the drug companies over that. We're going to be able to lower drug prices during this administration more than any administration in history.
So, you know, I agree with you. Just for the record, I offered that amendment in committee when we were doing reconciliation.
Thank you, Congresswoman.
And every Democrat voted for it, and I love my friends, but they voted against it. Just going to make that point. But can
All right, well, then let's work together on it.
Deal. But can you tell me how, I want to understand how you intend to get drug manufacturers to comply and lower their U.S. prices. Will you require manufacturers to align their U.S. prices with those overseas? And if so, how will you enforce it?
How do we're going to get it. We have a number of sticks and we have a number of carrots.
All right, we want to work with you. We got to do it.
I'm happy to go into detail.
I'm with you.
It's a very complex negotiation.
I know that.
And it's going to take not only cooperation with the drug companies, but cooperation with the European community, with Canada, with Japan, with Australia. And we're working on all that right now.
And we got to get our Republican colleagues to support us. Do you expect to reach manufacturer agreements on a negotiated price by November 1, as required by the statute, on time for seniors to be able to benefit from these lower drug prices at the pharmacy counter by January 1, 2027?
We are on time at this point. I don't know.
And at this point bothers me, so can we just work together to ensure it's done by November
Yes,
1?
absolutely.
Thank
I
you.
look forward to it.
Do you commit to rejecting administrative changes to the IRA that are contrary to your stated goal of driving down prescription drug prices for the American people?
Well, we are going to drive down prescription drug prices. I don't know what provisions you're talking about. If it's the negotiation provisions, as I said, we are doing that right now.
Thanks. And let me ask you, because we're going to run out of time, how does this commitment to lowering drug prices square with the administration's proposal to extend the period that small molecule drugs are excluded from negotiation from 9 to 13 years, thereby keeping drug prices higher for Medicare beneficiaries for an additional 4 years of these drugs?
I'm not sure what your question is.
Well, you've made it, some of the companies that we want to lower those drugs, you've excluded them from negotiations from 9 to 13 years on their patent. So that's going to keep it higher for Medicare beneficiaries. We're not going to be able to negotiate on a lot of drugs that seniors are taking.
Well, I mean, we're negotiating all drugs across the board. So, I mean,
I'm going to hold you to that. We're going to work together because we got to lower the cost of drugs for the American people. Thank you, and I yield back. Thank you.
Gentlelady yields back. The chair now recognizes the gentleman from Florida, Representative Bilirakis, for 5 minutes of questioning.
Thank you, Mr. Chairman. I appreciate it very much. Thanks for holding this hearing, and I want to thank you, Mr. Secretary, for your service to our country, and thanks for being here today. Secretary Kennedy, one of the areas I've been passionate about is the need for the U.S. to continue leading the world in developing innovative, life-saving treatments, and I know you are too. So this is particularly important and challenging in the area of rare disease and ultra-rare disease, where cures and treatments can be much harder because of the economic and regulatory hurdles to developing treatments for these very small populations. One important tool in promoting this drug development is the FDA's Rare Pediatric Disease Priority Review Voucher Program, which has led to the approval of over 50 treatments for 39 different rare pediatric diseases, 36 of which had no FDA approval treatments before the program began. I was very pleased to see the President's FDA budget allocate funding for this Priority Review Voucher Program, and I have bipartisan legislation that would fully reauthorize the program for years to come. So the question is, Mr. Secretary, will you commit to working with me to ensure this critical PRV incentive is retained for American innovators to develop new treatments for children with rare diseases? And can you elaborate on any additional initiatives that HHS foresees implementing to further accelerate the approval of life-saving treatments?
Yeah, I mean, this is another priority for us. I've met 2 weeks ago with CEOs and investors in from the biologic space, which are developing rare disease drugs. I was down in South Carolina about a month ago with Senator Tim Scott, inaugurating an innovative program to provide sickle cell disease to every person on Medicaid in South Carolina. There's 356,000 Black Americans who have sickle cell. It's an agonizing disease. It's just one of those diseases that we're talking about. In the big, beautiful bill, there's a provision that will relax some of the regulatory impediments for getting approval from FDA for rare diseases, and I urge you to take a look at that and support it. And Marty McCary now, as the director of FDA, is on a listening tour around the country, meeting with the innovators who are developing rare disease innovations. We are going to try to fast track that approval. We're using AI to fast track it. We're using an expansion of the compassionate use exemptions to expand it. And it's something that we talk about every day at HHS.
Very good, thank you. I have a question. 95%, the rare diseases, 95% did not have treatments, as you know, or cures. So I really, thanks for making that a priority. I look forward to working with you. Another question, I'm also encouraged to hear about the announcement last week to launch the Commissioner's National Priority Voucher Program, which aims to increase drug development in the areas the FDA deems to be in support of use national interests, which is so important. We saw this mechanism work successfully with the Operation Warp Speed and other efforts that the Trump administration has done to get red tape and bureaucracy out of the way and instead focus on accelerating gold standard science to develop cures. So the question is, I know I don't have a lot of time, can you speak further on the need for the National Priority Voucher Program and how HHS will broadly ensure U.S. leadership in innovative treatments and that those treatments are developed here in America?
We're using that program now extensively. We're very excited about it because it crashes through the red tape. It facilitates a very rapid approval of these drugs. We've already applied it to a number of new drugs, and it's something that we're going to, as I said, use extensively. So I appreciate your support on that, and I'm happy to work with you on it.
Well, I really appreciate it very much. I don't have a lot of time, so I'll probably yield back. But thank you again for thinking outside the box. That's what it takes.
The gentleman yields. The gentleman yields. The chair now recognizes the gentlelady from Illinois, Representative Kelly, for 5 minutes of questioning.
Thank you, Mr. Chairman, and thank you, Secretary Kennedy, for appearing before our committee. I'm pleased to see a focus on food as medicine and the well-being of all Americans in the FY26 budget, an issue of mutual interest and concern. I'm deeply troubled, however, by so many things happening at HHS under your leadership, especially your ill-informed decision to reverse existing recommendations for pregnant women and healthy children to receive the COVID-19 vaccine. The chair of the American Academy of Pediatrics Committee on Infectious Diseases described your decision as really concerning and taking away choice. The American College of Obstetricians and Gynecologists and the March of Dimes have also opposed your decision. Chairman, I have 2 items to insert into the record. ACOG's statement on HHS recommendations regarding the COVID-19 vaccine during pregnancy, or the COVID vaccine during pregnancy, and also RFK Jr. says COVID shots no longer recommended for kids and pregnant women.
Without objection.
Thank you. Due to my limited time, I ask that you please respond to my questions with a yes or no. Mr. Secretary, does HHS COVID-19 vaccine webpage reflect the department's view on COVID-19 vaccines? Yes or no?
First of all, what you said was wrong. We're not depriving anybody of choice. If a pregnant woman wants the COVID-19 vaccine, she can get it. We're no longer recommending it because there was no science supporting that recommendation. There's study after study that shows adverse events. One study, 27 adverse events during pregnancy from that campaign.
I'm going to interrupt you because I need to reclaim my
Another
time.
study shows an increase in miscarriage. There's no safety data for it, so we're not going to recommend it.
Not true.
We don't have safety
We have a
data.
pediatrician that is on this committee. Not true. I'll go back to, does HHS COVID-19 vaccine webpage reflect the department's viewpoint on COVID-19 vaccines? Please, yes or no?
I didn't understand the question. You're asking if,
The HHS's COVID-19 vaccine webpage reflect the department's viewpoint on COVID-19 vaccines.
I imagine it does. I haven't seen the website.
You haven't seen HHS's COVID-19 vaccine.
No, I haven't read the entire
Well, it's kind of
website.
troubling that you're unaware of what your own department's website states on the safety and efficacy of the vaccination. Let me read it directly to you. COVID-19 vaccines are safe and effective, and COVID-19 vaccines are available to everyone 6 months and older. Getting vaccinated is the best way to help protect people from COVID-19. Get vaccinated if you haven't. Chairman, I have the paper copy of the website to insert into the record. COVID vaccine 19, excuse me,
Without objection.
okay. And again, yes or no?
As I said,
Yes or no, within the past 45 days, has the CDC recommended COVID vaccinations for people at high risk? Yes or no?
for people at
I don't
high
have a lot
risk,
of time.
yes.
So in fact, on May 12, 2025, CDC stated in its interim clinical considerations for the use of COVID-19 vaccines in the United States, and I quote, COVID-19 vaccination is recommended for everyone aged 6 months and older in the U.S. CDC goes on to state that vaccination is especially important for a number of certain groups of people, including pregnant women, in order to protect themselves and their infants. Also, I'm inserting into the record the following copy of the
Congressman, we
website.
don't recommend COVID vaccines for pregnant women or for children.
Excuse me?
We do not recommend it for pregnant women or children.
I think I just read, especially important for a number of certain groups of people, including pregnant women, in order to protect themselves and their infants. I'm inserting into the record the following copy of the website, May 12, 2025, COVID-19 vaccines and vaccinations, Mr. Chairman.
Without objection.
It appears CDC was not consulted, given that it took days for them to update their immunization schedule to reflect your new policy. I'd like to insert into the record a Washington Post story reiterating this. CDC blindsided as RFK Jr. changes COVID-19 vaccine recommendations.
Without objection.
Okay, once again, yes or no? Did you consult CDC before changing vaccine policy related to COVID-19 vaccine as it relates to pregnancy?
We absolutely consult CDC on every policy regarding vaccination.
Okay, it's different than what, I yield back.
Gentlelady yields. The chair now recognizes the gentleman from Texas, Representative Crenshaw, for 5 minutes of questioning.
Thank you, Mr. Secretary, for being here. Saw you were in my district recently for an Ironman in the Woodlands. You might be asked for a lot of commitments today. Maybe one I'll ask of you is to get a good workout in with me at one point. I have a couple issues I care about, a few actually, direct primary care being one of them. So I'd like to start with that. I think we need direct primary care for a lot of reasons, and I've expressed those reasons on this committee many times. It's an affordable, flat fee for full access to your primary care physician of your choice, and I believe it's the future model for primary care. But for some reason, it's barely touched Medicaid, and that's a problem I've tried to fix. We have a bipartisan bill that has done that, the Medicaid Primary Care Improvement Act. It would make it clear in federal law that states could reimburse direct primary care providers directly. It passed the House last year, but never made it through the Senate, as many good things do not. I just would like to ask you, will you work with us and with CMS to issue guidance or maybe launch a pilot program allowing state Medicaid programs to integrate direct primary care models into their benefit design?
Yes, and in fact, Congressman Crenshaw, it was there was a direct primary care provision in the Big Beautiful Bill that was under the HSA provision. I believe that provision was approved by Congress.
It passed out of this House.
It passed, and then was moved by the Senate.
We are trying to convince the Senate to
get
keep
it
it
back
in.
at some point.
I'm glad with their support, maybe they'll keep it in. That's great to hear. And I appreciate your support on that issue. I want to talk about regenerative medicine also. It's a transformational medicine and therapy. I think you'd agree with this. These aren't hypothetical solutions. They're using the patient's own cells they're autologous cell therapies. They're using the patient's own cells to
to do some pretty amazing therapies and outcomes for people. As Secretary, what steps might HHS take to modernize that regulatory architecture for regenerative medicine, particularly for cell and tissue therapies that don't neatly fall into existing biologic classifications? And I introduced legislation, which passed the House yesterday, actually, that gives the FDA the opportunity to use the best science to update that policy. Would you work with us on getting that done?
Yeah, absolutely. And I had another roundtable on cell and gene therapy up at FDA headquarters with all of the leaders in that industry. It's something Marty McCary is deeply interested in. Jay Bhattacharya is. We want to keep the United States the hub, the scientific hub for development of cell and gene therapy. It is the medicine of the future, and we're absolutely committed to it.
I appreciate that. Another interest of mine, and I think we've had some legislative success as well in these past couple of years, is on the use of psychedelics for assisted therapy for conditions like PTSD, depression, addiction. What steps do you plan on taking to accelerate that domestic research, clinical trial access, and the safe deployment of these kind of therapies for trauma-related disorders?
We are launching clinical trials now on that at FDA. I think there are 11 clinical trials at the VA going on at this point, particularly for our service members, retired service members. It's critically important that we make sure that the science on this is solid, and the preliminary results are very, very encouraging, and it's something that we want to pursue. Marty McCary has told me that we don't want to wait 2 years to get this done. Yeah. These are people who badly need some kind of therapy. Nothing else is working for them. This line of therapeutics has tremendous advantage if given in a clinical setting, and we are working very hard to make sure that that happens within 12 months.
That's great to hear. Just to put on your notes as well, the FDA did issue draft guidance on the clinical guidelines for these therapies 2 years ago. Finalizing that, I think, would be helpful for the industry. So they have been forward-leaning, but I think finalizing that would be helpful for the industry. I'm running out of time, but maybe for the record, you could help us with this. In my bill, in Section 723 of the FY24 NDAA, that's where we got the money and the mandate for the DoD to do these clinical trials. And part of their own guidance was to work with NIH, and I'd like to figure out how that relationship is looking and what NIH is doing along with the Department of Defense.
We've brought on personnel to liaison directly with VA. I talk with Doug Collins about it all the time. It's something that both of us are deeply interested in.
All right, well, gentlemen's time has expired. We now recognize Representative Merrigan from California.
Thank you, Mr. Chair. Thank you, Mr. Secretary, for being here today. You mentioned that one of the focuses is to end chronic disease epidemic. So I want to talk about Alzheimer's. Alzheimer's devastates millions of Americans across this country. It robs loved ones of their memories, their independence, and ultimately their lives. Today, almost 7 million Americans live with Alzheimer's disease, and that number will double by 2060. I believe the NIH is doing research that is critical to the development of Alzheimer's disease treatments. Do you agree with that assessment? Yes or no?
We are completely committed to solving the problem of Alzheimer's.
Do you agree that the NIH's research is critical to the development of Alzheimer's disease treatments?
I do. The issue is complicated.
Okay.
If you want a real answer to that question, I'm happy to give it to you.
I have limited time. So you said that you think it's critical, yet you are proposing to cut $1.7 billion from the NIH's National Institute on Aging, which is the primary federal agency that supports and conducts Alzheimer's and dementia research. That's a lot of money, Mr. Secretary, for you being committed to ending an epidemic like Alzheimer's and saying that you believe that NIH does critical work. That is a ton of money. I want to turn to Alzheimer's disease research centers. Are you familiar with Alzheimer's disease research centers?
No, I can't say that I am.
Okay, well, let me tell you that the research centers, 35 NIH-funded Alzheimer's research centers, were helping families across the country. They support things like research, diagnosis, brain donation, and caregiver services. They were really critical, and they are very critical across this country in all states, red states, blue states, purple states. As of May 13th, 13 of the 35 centers have lost federal funding due to delays and uncertainty at the NIH. 13, that's a lot of them. Mr. Secretary, are you aware of that?
I am not, but I will look into it.
I really appreciate that you will look into that, because states like Florida, Georgia, and Tennessee have lost millions and millions of dollars. And I'm talking about red states and purple states, not just blue states. Well, sometimes it doesn't feel that way. That's why I say that. Now we're seeing layoffs, frozen brain banks, and halted research. That's almost 70%. That's almost 40% of our Alzheimer's research centers in crisis. So I want to ask that we insert into the record a number of articles. Alzheimer's disease research centers struggle as 1/3 lose their federal funding, and a second article of life-saving Alzheimer's research delayed by Trump funding cuts. Mr. Chair, into the record. Okay, I'm going to move on. I'm going to assume that's a yes, because my time is going. Okay,
With no objection.
So, Mr. Secretary, 14 of the centers that remain have their funding that's up for renewal in 2026. The budget you proposed, as I mentioned, is going to cut $1.7 billion from the NIH's National Aging, the Institute of Aging, which is the main federal agency supports it. What I would like is for you to commit that you are going to fully fund the NIH's 14 centers whose renewal and up is in 2026. Will you commit?
I can tell you that we have not cut any clinical trials on Alzheimer's.
I'm telling you that I'm just telling you there was 35, and you guys have already cut 13 of them because of the funding. This was congressionally approved dollars on a bipartisan basis. There is almost nothing more bipartisan than Alzheimer's funding, okay? Money was approved, congressionally approved dollars, and your agency has cut 13 of 35. I'm simply asking for a simple commitment, and that is from the 14 that remain, okay, that you at least commit to fully funding those.
I'm happy to work with you on this, Congresswoman. I don't know that what you're saying is true. It's something that I'll have to confirm, and I'm happy to work with you on it.
Well, I appreciate that you're going to work with me on that. But it is troubling that the head of the department doesn't know about these drastic cuts to something like Alzheimer's, which is so very, very critical.
Again, I don't know what you're telling me is true, but I'm happy to work with you on it.
General meeting's time has expired. I now recognize the gentleman from Pennsylvania, Dr. Joyce.
Thank you, Mr. Chairman. Thank you, Secretary Kennedy, for being here. Thank you for your commitment to serving our country. I appreciate your recent commitments to unlocking American science that we know will lead to additional breakthroughs. The Orphan Drug Act, which was passed the year that I graduated from medical school, has been a huge incentive driving innovation and delivering new cures and new treatments to American patients. Unfortunately, the Inflation Reduction Act has reduced incentives for innovators to conduct this critical research, particularly for orphan products that treat rare diseases and ultra-rare diseases. A recent NPC report has shown that since the IRA's enactment, clinical development for orphan drugs that received multiple designations went down by nearly 50%. My legislation, the Orphan Cures Act, would address this flawed incentive in the law and let American innovators return to pursuing breakthroughs in rare diseases. And I'm proud that this bill was included in the big, beautiful bill currently being considered in the Senate. Secretary Kennedy, will you commit to working with me and the committee to ensure incentives for innovators are put in place to pursue gold standard science
for rare disease treatments and for their cures?
Yes, Congressman Joyce, and I want to thank you for your leadership on this issue. It's a critical area. As you said, the Biden administration in the Inflation Reduction Act inserted regulatory impediments to disincentivize the developments of these kind of treatments. With your help, we've developed a fix for that in the big, beautiful bill, and I look forward to working with you on getting that passed.
Thank you, Secretary Kennedy. In 2022, when the IRA was passed, it included a narrow orphan drug exclusion protecting these drugs from government price-setting scheme. Unfortunately, CMS misapplied the timing for price-setting eligibility, starting the timeframe from its initial orphan approval date rather from the day that it is no longer exempt. And in this case, timing is indeed everything. A plain text reading of the statute shows CMS was wrong, and the Biden administration refused to fix their mistake. Secretary Kennedy, will you commit today to work with CMS to correctly apply the timing of a drug's price-setting eligibility so that this provision does not negatively impact innovation and in turn negatively impact American patients?
I look forward to working with you on that, Congressman.
Thank you. We look forward to working with you as well. Secretary Kennedy, to switch to another topic, under the Biden administration, we saw a consistent decline in the reimbursements paid to physicians under Medicare Part B. These cuts have led to more practice consolidation and increased hospital and insurer ownership of doctors. In turn, this has negatively impacted access to care for our nation's senior citizens and driven up out-of-pocket costs. How do you view these concerns, and will you commit to working with me and other physicians in Congress on how we can fix this erosion of reimbursement and strengthen the private practice overall?
Yeah, I mean, that's only one of the perverse incentives in our system that are contributing to the crisis in primary care. And one of the specific charges that President Trump has given me is to increase primary care access. And one of the ways that we need to do that is to make sure that primary care physicians are getting livable wages. And I look forward to working with you on that.
In America right now, the primary care physician is underpaid and undervalued. Your commitment to making sure that these doctors who are the front line caring for patients day in and day out are adequately compensated is important not just to American medicine, but ultimately important to the American patient. I thank you for that commitment. Mr. Chairman, my time has expired and I yield back.
The gentleman yields. The chair now recognizes the gentlelady from Washington State, Dr. Schreier, for 5 minutes of questioning.
Secretary Kennedy, on May 27th, you posted a 60-second video on your X account unilaterally changing vaccine recommendations without consulting the customary panel of experts. As a pediatrician, I find that extremely alarming. So I thought we would talk a little bit about some vaccine-preventable diseases. Secretary Kennedy, and these are yes or no questions, have you ever treated measles?
Do I what?
Have you ever treated measles?
No.
Well, I have. Let me tell you how miserable it is. These kids have high fevers, struggling to breathe, and they are crying. They suffer. Great news is that there is a vaccine to prevent it. Secretary Kennedy, again, a yes or no question. Have you ever treated bacterial meningitis?
No.
Well, I have. These babies are so sick. They come into the ER with high fevers, they are floppy, and we have to figure out why. Do you know how we figure out if a baby has meningitis?
Excuse me?
Do you know how we figure out if a baby has spinal meningitis?
How many babies?
I'm going to explain how we figure out and determine if a baby has meningitis.
Okay.
We insert a needle between vertebrae until the fluid that surrounds the spinal cord drips out into a test tube. It's called a spinal tap. We used to do lots of them. Fortunately, we don't have to do very many of these anymore Because we have 3 vaccines that prevent childhood meningitis. These are miracles. Secretary Kennedy, yes or no, have you ever treated pertussis or whooping cough?
No, I've had it.
Well, I have. And in infants, in fact, the one I treated, weeks old, came in because the baby just stopped breathing and turned blue. Let me tell you how scared those parents were. And I've treated a bunch of older kids with it. They cough so hard, they vomit. They run out of air. They break ribs. And if you don't catch it before 2 weeks, antibiotics don't even work. They cough for months with broken ribs, and that is why it is called a 100-day cough. But you know what's great? There's a vaccine that prevents this. Of course, here's the thing. Vaccines only work if you actually give them. And we know your record on this. We rely on the Advisory Committee on Immunization Practices, a panel of experts to recommend which vaccines people should get at which ages and the like. Now, I know Senator Cassidy had concerns about your views on this, and so when he voted to confirm you as Secretary of HHS on February 4th, he explained that decision by saying on the Senate floor that, quote, if confirmed, you will maintain the CDC's Advisory Committee on Immunization Practices without changes. But then 2 weeks ago, you fired all 17 experts on that very committee. Mr. Secretary, question for you. Did you lie to Senator Cassidy when you told him you would not change this panel of experts?
I never made that agreement.
So are you saying that Senator Cassidy lied when he was on the Senate floor, lied to the American people?
I didn't see that statement by Senator Cassidy. I've only heard it from you, but if he said that I agreed to it, it would be inaccurate. I made an agreement with him. I made an agreement with him, and he and I have talked many times about that agreement.
My time. I just want to tell you that for most of us sitting here right now, we believe Senator Cassidy more than we trust you when it comes to vaccinations. It sounds to me like you gave him the answer he needed to hear in order to get his confirmation vote, and then as soon as you were Secretary, you turned around and did whatever you want. You fired all 17 members.
I'm complying with all the agreements that I made
Mr.
with
Secretary,
Senator Cassidy.
You're now on the record. You lied to Senator Cassidy. You have lied to the American people. You have lied to parents about vaccines for 20 years. And I also want to be clear that I will lay all responsibility for every death from a vaccine-preventable illness at your feet. I yield back.
The gentlelady yields. The chair now recognizes the gentleman from Ohio, Representative Balderson, for 5 minutes of questioning.
Thank you, Mr. Chairman. Thank you, Secretary Kennedy, for being here today. As the co-chair of the Digital Health Caucus, along with my friend and colleague, Representative Kelly, I believe digital tools can play a huge role in improving the health of Americans. However, for these tools to serve the American people, we must continue to ensure accessibility and statutory protections for consumer wellness technologies. Secretary Kennedy, my first question is that there is a tremendous amount of research that shows that greater engagement with one's health leads to better outcomes. In recent years, American innovators have created and improved wearable devices so that not only are consumers able to better engage with their health through monitoring data, but they are able to share that data with providers. I believe American consumers, in line with the 21st Century Cures Act, should be able to access these innovative wellness tools. Secretary Kennedy, do you agree that consumers should continue to have access to these tools?
Absolutely. In fact, we're about to launch one of the biggest advertising campaigns in HHS history to encourage Americans to use wearables. It's a way of people can take control over their own health. They can take responsibility. They can see, as you know, what food is doing to their glucose levels, their heart rates, and a number of other metrics as they eat it. And they can begin to make good judgments about their diet, about their physical activity, about the way that they live their lives. We think that wearables are a key to the MAHA agenda, making America healthy again, and we are going to, my vision is that every American is wearing a wearable within 4 years.
Thank you, Mr. Secretary. Following up on my previous questions, what steps will you take, and you just said that you're going to do a big announcement next week to access digital health tools to track, monitor, and improve their health, while also ensuring appropriate patient data privacy, security, and protections. In dealing with some of that, I have had questions come up when I've spoken to medical groups about wearables and the privacy. Do you have anything reassuring for that, or would that be part of the announcement?
Well, as I said, we're going to do a major advertising campaign encouraging Americans to wear wearables. I've personally had friends who've utterly changed their lives just from wearing a glucose meter. And they've lost weight, they've lost their diabetes, diagnoses, and you see this happen again and again. It really has a miraculous impact on health in our country. And, it's $80 a month, and, we're exploring ways of making sure that that those costs can be paid for. The Ozempic is costing $1,300 a month. Right. If you can achieve the same thing with an $80 wearable, it's a lot better for the American people.
Great to hear. My office and I myself are also doing the same thing. I think we share the same belief that digital health tools, including telehealth and remote patient monitoring, are steps in the right direction in ensuring healthcare access. Specifically, I've been a strong advocate for the use and coverage of remote patient monitoring. During your time as Secretary, what progress do you hope to see in terms of access to and improvement of remote patient monitoring tools?
Remote patient monitoring, you mean like AI and AI nurses? Is that what?
Okay.
Yeah, we are working on that. As I said before, we've brought people into this agency who are the greatest technical expertise probably of any agency, except maybe the Defense Department, the CIA, and the United States government. I'm very encouraged by the caliber of people we've been able to attract to the agency, and that's one of the things we're doing. It's important. It keeps people out of emergency rooms. It's critically important for rural health care and for people who can't travel, for elderly Americans who can't leave their homes, but they can find out what's happening to their health without going to see a doctor or to go to an urgent care or an emergency room.
I agree with that, and I've been working with the federally qualified health centers doing some pilots with that. So, Mr. Chairman, thank you, Secretary Kennedy. Mr. Chairman, I yield back.
The gentleman yields. The chair now recognizes the gentlelady from Massachusetts, Representative Trahan, for 5 minutes of questioning.
Thank you. Mr. Secretary, during your confirmation, you told Senator Barrasso that rural hospitals are closing at an extraordinary rate. You called them economic drivers, lifelines in our communities, and you gave your word to protect them. Republicans on this committee also promised they wouldn't support a bill that led to more closures. Yet here we are. The Republican tax bill slashes Medicaid and the ACA by over $1 trillion, leaving 16 million more people uninsured and driving up uncompensated care. At the same time, it cuts provider taxes and state-directed payments, the few tools that states have to keep hospitals afloat. Cutting coverage and cutting payments, well, that's a perfect storm for closures, Mr. Secretary. So yes or no, with Republicans in Congress set to cut more than $1 trillion and counting from our healthcare system, will hospitals be forced to cut services or close altogether?
We're not cutting coverage for any American patient.
Well, it sounds like you don't want to admit the reality that your department
I'm happy to explain if you want to give me a chance.
Well, that's part of my next question. I want to hear what your funding mechanism looks like, because hospitals across the country have warned that this bill is what they referred to as a death knell. Even before Republicans in the Senate doubled the cuts, in provider taxes and state-directed payments, bringing estimates of hospital uncompensated care alone to more than $443 billion. Hospitals are raising a huge warning flag that the big ugly bill will result in closures and service reductions across the country in all our communities. I ask unanimous consent to enter into the record several of their statements and analyses. Mr. Secretary, if you claim the hospitals in our districts that are already operating in the red and serving mostly Medicaid and Medicare patients are going to survive, then where exactly is that money going to come from? What is your plan to keep them open and deliver the same level of service?
Well, the issue of state-directed payments, I think, as you understand, is a complicated one because the essential agreement under Medicare is that the states will pay a certain amount and the federal government will pay a certain amount. The states have learned to game that, some states have learned to game that system, so the federal government
If you
is
could
paying
just get to the
100%.
part where when that revenue stream
Excuse
is
me?
cut, how are you going to ensure that services aren't cut and hospitals don't close? I mean, many times, there's just no alternative on the table for a funding mechanism, so what's your plan?
Well, that is a decision ultimately that's got to come from Congress. So that's going to be up to you. But what I would say to you is that I would like to work with you on this because it's a complicated issue. It's not just that, it's not that simple. Are we going to?
I'm happy to work with you on this, Mr. Secretary, but this is going to happen in the next couple of weeks. And if there isn't a funding mechanism in place, if there isn't an act of Congress to replace that revenue stream, hospitals are going to close. People are going to die. When hospitals are pushed to the brink, they cut maternity wards, they cut mental health, they cut emergency rooms. That's who they cut first. This isn't hypothetical, it's already happening. From 2011 to 23, dozens of hospitals in states like Iowa and Texas eliminated obstetrics entirely. These are Medicaid department services, and under Donald Trump's bill, they're the first to go. And it's not just rural hospitals. We're seeing it in my district, too. The only maternity ward in north central Massachusetts shut down last year. Then the collapse of Steward forced 2 more hospitals to close, including one that served thousands of families. Boston Children's, one of the best in the country, is also at risk. Your budget slashes Medicaid, which covers over 40% of kids, and eliminates programs that trains most pediatricians. Hospitals are already bracing. They're pausing projects, they're canceling expansions, they're shelving cost-saving investments. The chaos that your budget creates, including decimating NIH, is driving up costs.
We're not cutting Medicaid. There's no cuts to Medicaid. There's simply restrictions in the growth of Medicaid over the next decade.
People are going to lose their coverage. Uncompensated care is going to rise. Hospitals are not prepared for that reality. Look, here's the truth. People are going to die. These hospitals are going to close. Labor and delivery units are going to disappear. If mental health services are stripped away, that's the consequence of your policies. And look, you've already shown that you don't have a grip on your department. You don't know basic things that are on your website or programs that are closing.
Gentlelady's time has expired. The chair now recognizes the gentlelady from Tennessee, Representative Harshbarger, for 5 minutes of questioning.
Thank you, Mr. Chairman, and thank you, Mr. Secretary, for being here today. First of all, I want you to personally know how much I aligned with your philosophy on making America healthy again. As Buddy is a pharmacist, so am I, and have done that for 38 years using conventional and traditional functional medicine compounding, to fill the gap when traditional medicine either didn't work for that patient or when it failed the patient. And on a side note, talking about these clinical trials and this research, there's bias in clinical research. And we know it is pervasive, and it can absolutely reshape the findings and the outcomes of the clinical trial, and it's due to the methodology or the design flaws in that or selective reporting on things that they might want to hide. And you do not know that until you litigate that. And so that's just a side note. But what I want to talk to you about is PBM reform. We know the president's talked about pharmacy benefit managers and that reform. There's bipartisan support in Congress on how to address that because they lack transparency and create conflicts of interest that distort competition, reduce choices for consumers, and increase the cost of drugs. And they really take a toll on independent community pharmacies. Is there anything in the president's budget, sir, that you know that would address the PBM industry to make prescriptions more affordable?
Yeah, that's a big concern of the president's. The PBMs are now siphoning off about 40% of the costs of pharmaceutical drugs. And the president wants to end that, and he's going to do it through transparency and through a new mechanism of direct-to-consumer sales of pharmaceuticals that would fence out the middleman altogether.
Yeah.
These are issues that we are talking directly about in our negotiations with the pharmaceutical companies now under most favored nation status.
Yeah.
It's something the president's committed to, something that we're committed to here at HHS, and we're going to get it done.
Yeah, I think we'd probably have to renegotiate those 340B contracts with that because those are for underinsured or uninsured patients, so we can certainly talk about that. So I'm glad you're working on it. Thank you for your apparent interest in functional medicine. You know, compounded medications are something I've done for all these years, and we make those customized medications without the dyes, the fillers, or other ingredients, and we step in when patients can't take those traditional medications. And what you're doing by banning some of these dyes and things we've done for many years. And there's issues with some of the regulations that the FDA imposes on us, areas of common interest that I want to work with you and Commissioner Director McCary with. There's a blueprint of ideas that I have right here, and I'd like to submit this for the record, Mr. Chairman.
Without objection.
That's been released to eliminate redundant and ineffective regulations that impede patient access to those compounded drugs. And I'd like to work with the FDA on that and fix some of the incompatibilities and some of the unidentified or clarify some of those laws that the FDA has put into place that keeps the patient from adhering to that medication.
Well, I'd appreciate if you provide me a copy of that.
Sure. I
Under
think they
the
have
president's
delivered that.
executive order, we're required to eliminate 10 regulations for every regulation we adopt, so we are looking for targets, and this sounds like a target-rich environment.
Listen, I have many target-rich ideas that I would like to just do away with, and I will work with you. And I think you may have a copy of that in your office, but I'll be happy to get that to you, sir. Infusion benefits are another thing. There's so many regulations in Medicare that prohibits that patient from getting the medication, and I've talked to Dr. Oz about that. When it comes to oncology patients, you know, there was a stark clarification law that they could not mail that to the patient, and it's not to the benefit of the provider. You know, I'm in a rural East Tennessee, and these patients can't drive themselves to get that medication, and they are prohibited from having anyone pick it up. So things like that are what I would love to work with you on.
We would love, it's our objective to make sure that infusions can be applied in the home, can be used in the home, and we need to change that. It makes no sense. It's much more expensive for our system. It's literally billions of dollars a year that are unnecessarily spent by forcing these patients, particularly in rural areas, elderly patients, that could easily use the infusions to home to force them to come into a hospital to use them. And it doesn't make any sense, and it's part of the common sense reforms that we're doing here at HHS.
Yeah, thank you, sir.
The gentlelady's time has expired. The chair now recognizes the gentleman from Texas, Representative VC, for 5 minutes of questioning.
Thank you, Mr. Chairman. Mr. Secretary, this country is in the grip of an opioid epidemic that's ripping through America. It's gutting our schools, it's shattering our neighborhoods, and it's tearing families apart. Between 1999 and 2019, overdose deaths involving opioids skyrocketed over 500%. And this epidemic has not discriminated. It doesn't care if you're rich, if you're poor, if you're black or you're white, if you're Democrat or Republican. It takes veterans, mothers, students, and children. Over 240,000 children have lost a parent to opioids, an entire generation growing up with grief and trauma, and over 42,000 veterans lost to overdose. And now, instead of strengthening the VA, the administration you work for plans to gut it, cutting 80,000 jobs, cutting resources from heroes who fought for us. In 2020, 48,000 Americans died from opioid overdoses. Despite historic progress under the Biden administration, where overdose deaths dropped 65% from 2023 to 2024, this administration now plans to cut critical programs and fire behavioral health and crisis specialists, threatening to strip hundreds of thousands of veterans of life-saving treatment to prioritize billionaires over those who served. But most egregiously, in the FY26 budget, the Trump administration is proposing to slash over $1 billion from the Substance Abuse and Mental Health Services Administration. That is literally $1 billion ripped away from treatment, prevention, and hope. Mr. Secretary, you don't slash lifelines in the middle of a rescue. You don't call 911 and hang up halfway through. And you sure as hell don't preach about redemption while cutting the funding that makes redemption possible. So let's be clear. This isn't a budget, it's a death sentence. And now I have a few questions for you, Mr. Secretary. Mr. Secretary, do you believe the United States is currently facing an opioid crisis?
And that's why I've reauthorized.
So you do. So do you believe the federal government has a responsibility to combat this crisis, yes or no?
The federal government has a role in it, certainly.
Thank you.
An important role.
Mr. Secretary, you're aware that the president's own brother died from addiction. You've heard J.D. Vance, the Vice President of the United States, talk about his mother's addiction. And you've talked about your own history and your own addiction issues in 1983, where you sought treatment for heroin addiction at a rehab facility in New Jersey. Was that treatment effective for you?
I've been sober.
Okay.
I also would point out that I lost a brother to this disease. It's a priority for me, and it's going to be a priority for HHS.
And let me also ask you, do you believe, yes or no, do you believe that structured recovery programs were essential to your own recovery?
My recovery program was mainly.
Yes or no? Do you think that was important for your own recovery?
It was important.
Okay, so Mr. Secretary, overcoming addiction is commendable. I've had family members that have overcome addiction. I commend you for that. But not everyone have the resources that your family has to get the care that they need. And because you know better than anyone that recovery without treatment is challenging at best. So, Mr. Secretary, please tell me, why would you deny millions of Americans the same access to care that saved your life?
We're not denying anybody access to care, Congressman. We're shifting some of the funding away from SAMHSA to the states. The addiction problem in West Virginia is very different than the addiction problem in
Let me ask you this, Mr. Secretary. You've credited the 12 steps in your recovery. So can you tell this committee what is step 4?
It's making a fearless inventory.
Is making a fearless inventory of ourselves.
Yeah.
And you remember that one. And do you remember step 12?
Yeah, it's having had a spiritual awakening, we try to help other alcoholics and addicts.
So tell me, Mr. Secretary, yes or no, does cutting off treatment for people still suffering align with step 4 and step 12?
We're not cutting off treatment for anybody, Congressman. As I said, I'm happy to explain it, but you don't give me any chance to answer questions, but which is part of the game that we play here.
Mr. Secretary, I've heard your story. Again, I think that it's great that you talked about your recovery. But, man, you can't pull the ladder and shut the door. There are people like President Trump's family and your family that have resources, but there are families like mine and Secretary Vance's.
Gentleman's time has expired.
As we said, we're not denying.
Time has
We're not
expired.
taking treatment away from anybody.
The subcommittee is going to take a quick 5-minute break. We'll be right back in 5 minutes.
And then he's going to stay for 15 minutes more, they said. That's what they said.
Oh, good, good.
Because he came in 10 minutes late.
Let the witness get back. Dr. Miller Meeks for 5 minutes of questioning.
Thank you, Chair Carter, and I thank the Secretary for being here with us today. Secretary Kennedy, I'm going to gauge my line of questioning on some of the things you're just asking. As you indicated, you're aware of the opioid epidemic and that it's still a pressing issue in many parts of the country, including in my district. As a physician, 90% of acute pain patients receive opioids to manage their pain, whether they need them or not. Between 2011 and 2019, opioid prescriptions decreased by 40% from approximately 250 million to 150 million prescriptions dispensed. And this is true across most payer audiences, Medicaid, private, cash patients. However, among Medicare patients, opioid prescribing actually increased. Furthermore, Medicare's share of opioid prescribing during this time increased substantially from approximately 20% of the country's opioid prescriptions in 2011 to 35% in 2019, and that represents a 75% increase in just under a decade. I have a bill, the Alternatives to Pain Act, that would increase Medicare beneficiaries' access to non-opioid alternatives to pain management medications by limiting patient cost sharing, prohibiting the use of utilization management, and encouraging a dialogue between patients and their providers. I was also the director of the Department of Public Health in Iowa, which handles substance use disorder and behavioral health disorders. And I think, given your personal experience with this, there was something that you were trying to say, and if you would, I would like to give you an opportunity to complete your thoughts on the previous question.
Thank you, Congresswoman. This has been a priority for me. I've been 42 years in recovery. I lost a brother to this disease. I lost a niece during the pandemic. We've all lost friends. We've all lost family. This is a national tragedy. We should be talking about solutions to it, and we should be working together. There's no such thing as Republican children or Democratic children. All our kids are affected by this. We should be able to talk with each other about this without vitriol, without the vilification, and try to figure out the best ways for treating our kids. The Trump administration, the federal government has not done a good job at this. The Trump administration's policy is to return that money in block grants to the states and let them figure it out. As I said before, addiction in West Virginia or in Iowa is very different than in San Francisco. The solutions are different. And we need to turn those states into laboratories of innovation. They can figure out how to treat their population the most humane. Some of the best treatment centers I've ever been to are in rural Tennessee with no federal funding, no state funding, and getting extraordinary reductions on recidivism. We want to unleash that spirit of innovation in the states to make sure that we're doing the best we can for our kids. And in answer to your first question, there's a very, very exciting new drug out there called Journavex, which is a non-opioid, very effective non-opioid pain reliever. And we are doing everything we can across our department to promote access to that solution.
And would you be supportive of something like my bill, Alternatives to Pain Act, and commit to working with me in providing technical assistance?
Absolutely. Thank you, Congresswoman.
Thank you. Also, you've heard concerns about members on HHS restructuring, and having restructured a department, it's never an easy task. We also know that sometimes money goes to people within the bureaucracy rather than to the actual delivery of care, as you've indicated. And there's been changes in NIH funding and HHS funding. And my district, which encompasses Southeast Iowa, is very rural. And I was just wondering if you can explain how HHS will be investing in rural America, and specifically rural Iowa, to ensure that Americans still have access to vital healthcare services.
We have a number of programs for doing that, for expanding healthcare in rural areas. One of those that I'm most excited about are these innovations in telemedicine and in AI nursing. That is going to deal with some of the treatment, the diagnosis issues. I've seen these systems in action, and they're extraordinary. And that AI can now diagnose disease as good as any doctor. Not as good as let's say the average doctor.
Thank you for clarifying. My time's expired. Thank you very much,
Right,
Secretary. I yield back.
The gentlelady yields. The chair now recognizes the gentlelady from Texas, Representative Fletcher, for 5 minutes of questioning.
Thank you, Mr. Chairman. Secretary Kennedy, do you know the requirements for hospitals under the Emergency Medical Treatment and Labor Act, which is commonly called by its shortened name, EMTALA?
Yes, I do.
And just generally, what do you know EMTALA to require of hospitals?
That every hospital has to treat anybody who comes to the emergency room.
And they have to provide stabilizing care regardless of their ability to pay and regardless of the type of care required, correct?
Exactly.
And Secretary Kennedy, you understand that according to the American College of Emergency Physicians, the American College of Obstetricians and Gynecologists, the American Medical Association, and the Society for Maternal Fetal Medicine, in certain circumstances, necessary stabilizing care for the purposes of fulfilling a hospital's obligation under EMTALA could be providing abortion care, correct?
In cases, for example, ectopic pregnancies and botched abortions and in miscarriages, those hospitals are required to provide care. Elective abortions, they're not.
but they are required to provide abortion care if that is the care that a physician treating the patient determines in their medical judgment is the care necessary to stabilize the patient and to protect their life and health, correct?
And because there were confusion about that, I sent out a letter to every hospital in America, provide care.
Okay, and I think that that's consistent with what we have heard from emergency physicians, obstetricians, other treating physicians that have made clear that in certain circumstances, clinically recognized, evidence-based, necessary medical treatment in various circumstances, including but not limited to the ones you just listed, abortion care is the necessary stabilizing care or some kind of care that may end a pregnancy. So in those cases, you would agree with me that EMTALA requires the hospitals to provide that care?
Yes.
And
that's what President Trump believes.
And you just mentioned that you issued some guidance to all the hospitals and care providers across the country, rescinding some guidance from the prior administration and making clear that that is the requirement. Now, the guidance that you rescinded was issued shortly after the Dobbs decision, which was announced 3 years ago today, and created some confusion. And so I think one thing that's important, one thing that I hear from doctors in states like mine, is that this kind of guidance and clarity is very, very important to giving the practicing physicians the comfort that they need to do their jobs. And so I think it's really important that you continue, and I hope that you'll continue to make as clear as you have today in this hearing, that EMTALA ensures and protects pregnant women in all 50 states.
I will continue to do that, Congresswoman.
And with the time I have left, on one other note, in response to some questions from Mr. Pallone earlier, he talked about, as I believe Ranking Member Dingell has as well, several of the letters that our committee has sent, or members of our committee have sent to you with concerns about actions being taken at HHS. And certainly, I agree with a lot of those concerns. I represent Houston, Texas, and we have an incredible amount of research going on through National Institutes of Health, incredible development of all kinds of transformative therapies and treatments. And so we have a lot of concerns. I know you mentioned that you have gotten thousands of letters from members of Congress, and I can appreciate that. But I would ask that, recognizing that this committee, the House Energy and Commerce Committee, has jurisdiction and is the committee of jurisdiction over HHS, that the requests that come from the ranking member, that come from the Energy and Commerce Committee get prioritized by your staff in terms of looking at congressional responses. I think it would be very important because we have jurisdiction, and you've indicated you'll work with a lot of folks here on a lot of different issues, and getting those answers and being able to work to address the concerns that we have is really important. So I just ask that you prioritize those responses.
You have my commitment to do that, Congresswoman. And I would also say this, and it's the same thing that I said to Congresswoman Dingell. It's not our intention to cut anything that is the kind of research that you're talking about, which is a critical research. We need to keep America the hub of that kind of research. And there was some malicious compliance. There was some mistakes made.
Thank you, Mr. Secretary. My time has expired, and so I will go back.
Please contact us, and we will redress them.
The chair now recognizes the gentlelady from Florida, Representative Kammick, for 5 minutes of questioning.
Thank you, Mr. Chairman, and thank you, Secretary Kennedy, for being here. I know that this has been a bit of an interesting morning, but I do appreciate your commitment to the initiative to make America healthy again, as well as all the other reforms that you're looking to initiate. As someone who represents a very large and rural district in Florida and cares deeply about access to care, especially for our underserved communities, I've seen the good that HHS can do, but I've also seen where the bureaucracy falls short in helping people, particularly in rural areas. So I'm encouraged significantly by your willingness and efforts to restructure the department. Now, I know that there are many broken systems within HHS, and it's going to take a disruptor. And, sir, you are a disruptor, and that's what we need in these times, because so many people, especially here in Congress, they want to maintain the same unbroken status quo. I think collectively as Americans, whether you're Republican or Democrat, we can agree that we have sick care in this country, not health care. And the culture has been all about maintenance rather than prevention. And so I appreciate all of your efforts in working to try to address that. So I'm just going to jump right in. As you know, Secretary Kennedy, under the previous administration of Joe Biden, maternal health deserts expanded significantly, leaving over 2.5 million women without access to any sort of maternal health care. In fact, I believe it was 1 in 25 maternal health clinics closed under the previous administration. And you've pointed out that there are more than 40 different maternal health programs scattered across HHS. So from where I sit, that sounds like a lot of bureaucracy, and I want us to focus on patient outcomes and improving those, such as like you do. So walk us through how you're planning on streamlining and making a more coordinated effort to deliver healthcare to moms and moms to be around the country.
Yeah, I mean, this is a priority for President Trump. It's a priority for me personally. We have a maternal health crisis in this country. It disproportionately impacts minorities. Black mothers have a 2.6 times greater chance of dying in childbirth. A black mother with a college education has 2.6 times greater chance of dying in childbirth than a white mother with a high school education. So it's impacting those communities, but it's impacting every American. And we need to protect our moms, we need to protect our kids, and we need to do a lot better. So, and we intend to do that in this administration.
Well, as someone who is 8 weeks out from delivery, I know you can't see it because I'm so short, but I appreciate that, and I look forward to working with you so we can streamline these services so moms can get the help and access to resources they need. Changing gears a little bit here, the DHS Inspector General has confirmed for us what so many of us have known for a long time, that under the Biden-Harris administration, HHS, which is responsible for unaccompanied children, they lost track of over 340,000 unaccompanied migrant children. They failed to vet sponsors, and they blocked law enforcement from getting critical information to ensure the safety of these children. Now, we know several investigative reports, both from government sources and outside, have reported that these kids were sent to unsafe addresses, even non-existent ones. They were exposed to trafficking and exploitation, and many of them have not been found to this day. Now, I know you've had a lot on your plate. It's been a crazy 6 months, but I know this is a top priority for HHS. So like so many other things that you've been tasked with cleaning up, what specific steps is HHS taking to restore the accountability, improve the sponsor vetting, and ensure that law enforcement can do its job to protect these children and find these children?
I mean, one of the major reason that the Biden administration lost track of all those children is because they were emphasizing speed over security. And there were political reasons for that. They wanted to get the kids out of U.S. custody, so they were handing them off to anybody. They didn't require background checks. They didn't require identification even. I've watched horror stories of the same person picking up child after child after child, using different names and different addresses. One of the addresses was a strip club. One of the addresses was a parking lot. One of the addresses was an empty lot that was filled with shipping containers. And this character was getting all these kids. One person got 42 kids to one address. What we're doing now is DNA testing on every sponsor. We're doing personal identification. We're doing background checks, and we're doing income verification.
Thank you, Mr. Secretary.
Thank you. My time has
The
expired.
gentlelady's time has expired. The chair now recognizes the gentlelady from New York, Representative Ocasio-Cortez, for 5 minutes of questioning.
Thank you so much, Mr. Chairman, and thank you, Secretary Kennedy, for being here today. It's actually not our first time meeting. We met a very, very long time ago when I was 9 years old in Westchester Putnam County at a Riverkeeper event. And I remember back then you talking about the importance of science and environmental action at that time. Listening to a lot of your discussion and a lot of the messages that you provide to people. You talk a lot about corporate influence and corruption in government. And this is an area that's very important to me, and it's an area that I do a lot of work in. I am, as a public servant, completely financially divested of any conflicts of interest with any healthcare companies, any stocks, any lawsuits that I would financially benefit from. Are you?
Yes.
You're completely divested.
Yes.
You have no financial interest in any lawsuit, crypto, none of that.
No. Oh, crypto? I own Bitcoin.
Okay. And do you have any other securities or assets?
I don't. I mean, I had to go through this with the Office of Government Ethics, and I had a few interests that were very minor that I divested.
Okay, just checking. I'd always like
no,
to.
it's a good question.
I always like
I'm
to know
glad you asked it.
what the field is before I enter conversations. So thank you for that. In the healthcare space, something that we've both spoken to is that some of the worst actors are in the for-profit medical space. Are in for-profit health insurance, big pharma, et cetera. And one of the worst companies, actually, is United Healthcare in this respect. United Healthcare is the largest health insurance company in the country. They are the largest employer of doctors and own thousands of pharmacies, clinics, surgery centers, and home health agencies, as well as hospice providers. Secretary Kennedy, are you aware that President Trump's Department of Justice is reportedly investigating United Healthcare for criminal insurance fraud in some of their for-profit health insurance plans, like Medicare Advantage?
I'm not aware of that investigation.
You are not aware that the Trump Department of Justice is investigating the largest insurance company in America that
No, I'm not aware of.
for fraud in Medicare Advantage
No, I'm not aware of that.
that
but
you have jurisdiction over?
It doesn't surprise me.
Okay. In your submitted testimony, you said HHS takes seriously our role as responsible stewards of taxpayer dollars. Are you aware that for-profit insurance corporations like United Healthcare have been found to be defrauding public dollars of more than $80 billion a year?
I'm not aware of that number, but
You're
I'm
not
aware
aware
that
of
there's
that?
fraud across the for-profit sector.
Respectfully, Secretary Kennedy, if we're making decisions around waste, fraud, and abuse, this is the largest source of waste, fraud, and abuse of public dollars in the public insurance
You
space.
say $80 million?
$80 billion a year.
80, did you
and
say 80 million or 80 billion?
80 with a B, billion.
With a B,
Yeah. If that's the case, why did you nearly double the rate that taxpayer dollars give for-profit insurance companies like United next year, if you don't know those things?
Double the rate? How did I do that?
So your agency nearly doubled the taxpayer dollars that for-profit insurance corporations like United will be paid next year, meaning these companies, the largest of whom is under investigation, criminal investigation by the Trump administration, will be receiving an additional $25 billion from your agency.
How is that happening?
I would be happy to submit to the congressional record evidence of this. I will enter the CMS press release from April 7th of 2025 into the record, which states that Medicare Advantage corporations will now receive a 5.06% increase in payments next year under your jurisdiction, Mr. Secretary.
Well,
This is up from 2.2%.
I mean, what rate
Without
is
objection.
Proposed from the Biden administration. You are doubling the rate that the Biden.
The
that
gentlelady's
these
time has
criminally
expired.
investigated companies.
The gentlelady's time has
receiving.
expired. The chair now recognizes the gentleman from Michigan, Representative James, for 5 minutes of questioning.
Mr. Secretary, welcome. Thank you for your time and your service. I am grateful for you being here. We've gotten to have some real good conversations here today because when it comes to the health of this country, as has been said many times before, we do not have a health care system. We have a sick care system. I'm just going to jump directly to my questions here. In your time and your research, do you have any objectives or any ideas on how to reverse the perverse incentives and some of the abuses that are happening with big companies and big government that are hurting people right now?
I mean, at every level of the system, there are, as you say, it's just a bundle of perverse incentives that encourage people that basically put every actor in the system, pharmaceutical companies, providers, hospitals, insurance companies, in a advantageous position if they increase the number of sick Americans and the level of our illness. And the way that we need to change that broadly is to realign the incentives so that people are getting paid to actually make people better. So we want outcome-based medical care. We want value-based medical care. We're working through the Center for Medical Intervention for CMI at CNN to explore a number of pilot projects that will do just that. And then we want to roll them out across the system. But we're looking for every opportunity, and I had meetings all this week, including with all the big insurance companies that will do exactly that. They want to do it too. They understand this is not what anybody wants. It's
And
not
we've
good
spoken
for
with insurance companies too, and that's a big issue. But another big issue in the United States is we are still treating all calories equal, and they should not be. Ultra-processed junk food doesn't stack up to the calorie from an apple or fresh Michigan produce. We all know that we need to step up and address the fact that ultra-processed foods drive obesity, heart disease, and diabetes. But in Congress, we're still tiptoeing around the fact that less than 10% of Americans even follow current guidelines. Current food system is poisoning poor people, and it's wrong. During this drives up costs in our healthcare system or sick care system, and it drives up our national debt. It's a national security issue. Are there any plans that you can share here today to address the food deserts in urban areas and rural areas across states like Michigan? You mentioned changing some incentives. Well, the leading areas before people get sick in the first place is a great place to do it.
Yes, Congressman, the first thing that we need to do is to recalibrate the dietary guidelines, and those are due in December. We got a 453-page document from the Biden administration that was just the product of the same kind of industry control that put Fruit Loops at the top of the food pyramid. And we're now going to give Americans a 4 or 5-page document that tells them what they should be looking for, particularly in their locality. And when we do that, it's going to drive good food. It's going to reduce the amount of processed food in our school lunch programs, in our military, in our hospitals, and other institutions. And it's going to drive good food. That's going to create markets for good food all over the country. And that's one of the ways we penetrate the food deserts.
Very good.
There's also
Secretary,
programs under Medicaid to make sure that people in food deserts, on Indian reservations, in urban areas, et cetera, can get good food.
Very good. We absolutely have to take care of the poorest of the poor. We need to make sure that folks who deserve it can have support from us. Yesterday,
by the way, we're going to have the dietary guidelines out at least by August, so we're going to be months early, and I'm working with Brooke Rollins on that. And they're going to be very good.
The government being early on something, that's great. Secretary Kennedy, yesterday you and CMS Administrator Oz secured an industry pledge to fix our broken prior authorization system. I hear stories from places like Flint, Michigan, where Dr. Bobby Mukamala sought prior authorization for full cancer screening after his patient's stage 1 tonsil cancer diagnosis so that he could determine the best treatment outcomes. When the patient finally received the PET scan 3 weeks later, the cancer had progressed to stage 2. These prior authorization reforms are critically necessary. What are you talking to industry folks about to hold them accountable for their pledges?
The largest companies in the industry, and I brought them all together, have now made the pledge to us yesterday that they're going to get rid of 80% of the prior authorizations. And they're also going to, make their systems interoperable. So it's much easier for a doctor to very quickly, before you leave the office, you should have that prior authorization.
The gentleman's time has expired. The chair now recognizes the gentleman from Massachusetts, Representative Auchincloss, for 5 minutes of questioning.
Good afternoon, Secretary. You've emphasized throughout your career concerns about corruption and conflicts of interest in healthcare, yes?
About corruption in healthcare?
Yes.
Yeah.
And you've pledged during your confirmation hearing and then again today, quote, radical transparency, yes?
Yes.
Yes. And you explained to my colleague from New York that you divested yourself, yes?
Yes.
And you fired the 17 members of ACIP because you think they have conflicts of interest, yes?
Yes.
And do you think that everybody within Health and Human Services at a senior level should hold themselves to a standard of radical transparency and divestment?
Well, I'm going to hold them to that standard, but...
So not everybody should hold themselves to a standard of
yeah,
radical
everybody, and the OGE makes them all divest.
So everybody should divest and everybody should be radically transparent. Who works for you?
Yes.
Yes. And does that include people who have involvement in Health and Human Services policymaking, even if they're not in your department? Would you want them to be radically transparent as well?
I don't have any control over anybody except those in my department.
Well, I think you do. Let's talk, though, about how radically transparent you have been to date, because I want to ensure for the American public that they're getting what you pledged. Mr. Kelly Means is a special government employee. He's also a White House advisor. You know him well. He actually introduced you to Donald Trump. And he's the founder and the owner of TrueMed. Now, TrueMed is a company that sells saunas and supplements and maybe medical devices that you described to people with using pre-tax dollars. And he has described his mission as routing federal funds away from health insurance programs towards these health savings accounts. Now, Mr. Means has tremendous influence over Medicare and Medicaid based on the executive order on Making America Healthy Again and the One Big Beautiful Bill, which both call for the expansion of HSA usage for these wellness and supplement products. So that's a direct revenue stream for his company while he's working in the government. So my question is, would you require Mr. Means to sign the financial disclosure forms that you're very familiar with?
I have no power to do that, but I find it interesting that you bring that up.
I'm going to reclaim my time.
Pharmaceutical companies have been in the White House for generations.
This is
none of you
my time,
about
Secretary, my time. Would you require, in keeping with radical transparency, that this individual who you're very close with, who has a major role in shaping MAHA agenda, and you have said so yourself publicly and many times, would you require him, before working on the MAHA agenda, that he sign those disclosure forms?
I have no power to require that. I can require people in my agency, and I've done that.
Will you continue to work with him if he does not sign those forms? With Mr. Means, will you continue working with him if he does not sign those forms?
I work with everybody, including all the pharmaceutical companies.
Do you think that he should respond to the letter that I wrote? Do you think that he should respond to the letter that I wrote requiring him, or asking him, I should say, to be transparent about potential conflicts of interest between TrueMed and CMS and the MAHA agenda? Is that something that he should do, in your opinion, in keeping with divestment? I mean, because you've said, sir.
You wrote me a letter?
He said, sir, you said before.
Are you saying you wrote me a letter?
I wrote Mr. Means a letter asking him to respond. Do you think he should respond?
That's between you and him. As I said, there's been pharmaceutical companies for generations in the White
Secretary,
House, and nobody complained about it.
Secretary, you said that everybody who works on health policy should follow high standards of radical transparency and divestment. So I've asked him questions about whether he's done that. Should he, in keeping with what you just said at the top of this, should he be radically transparent?
Let me ask you this. Have you accepted $400,000 from pharmaceutical companies?
The reason you know that is because I have financial disclosure forms, and I'm asking him to submit the same thing. So should he do the same thing? Because when he doesn't, let's talk about what happened. Let's talk about Mr. Brad Smith.
Should you be prevented from accepting money from pharmaceutical companies? Because it says here you've accepted $400,000.
Mr. Kennedy, you asked Ms. Ocasio-Cortez, how did I do that when she talked about the higher rates given to the Medicare Advantage organizations? I actually have an answer for you. How did that happen? The answer is Mr. Brad Smith. So he was in charge of Doge Healthcare, and his biggest investors at his company, Main Street Health, are the Medicare Advantage organizations, the 5 biggest health insurance corporations in America. They're his investors. He owns this company. They own him. And while he was there, he set the rules and reimbursements for CMS to hook up his investors. So I'm going to answer the question that you asked Ms. Ocasio-Cortez. It is because of conflicts of interest. Do you think that CMS should continue to do business with Main Street Health under your watch? Is that radically transparent?
Are you saying that we should cut Medicare Advantage?
Do you think that Main Street Health should continue to do business with Medicare and Medicaid given the conflicts of
interest? Are you
interest?
saying we should cut Medicare Advantage?
Mr. Kennedy, your dissembling and diversion distracts from the fact that you refuse to be radically transparent with either Mr. Means or Mr. Smith. I'm going to enter for the record now documents.
You didn't give any money to United.
Claims. Auchincloss oversight letters to Means and the Board of TrueMed and Main Street
Without
Secretary's
objection,
All submitted.
the gentleman's time has expired. The chair now recognizes the gentleman from California, Mr. Obernolte, for 5 minutes of questioning.
Well, thank you very much, Mr. Chairman. Mr. Secretary, thank you for being here. I particularly appreciate your enthusiasm for using artificial intelligence to enhance productivity at HHS. I think in your testimony you said the AI revolution has arrived, and we would agree with you. I was the chairman of the House Artificial Intelligence Task Force last year, and we produced a report in December that had a whole chapter on healthcare because we believe that there is no industry in the United States that's going to be more radically transformed by AI than healthcare. You also testified about the healthcare cost challenges that we're facing in this country, the fact that we spend between 2 and 3 times per capita what other developed countries do, and we achieve worse healthcare outcomes. And I think you and I share a belief that AI can help with that. So I'm delighted that you are applying AI to make HHS more efficient. I think you testified you're using it to expedite drug approvals, which is wonderful. I'm wondering, though, if how we can catalyze attacking it from the provider standpoint, because we have physicians that spend twice as much time on administration as they do on patient care. And we've got reports from think tanks that indicate that if we utilize AI effectively, we can cut 10% off of the cost of providing health care to Americans. So what can HHS do to catalyze the adoption of AI and the securing of those benefits on the provider side?
We are doing that at every level of the department, and I'm surprised it's only 10%. It's just the waste, fraud, and abuse, and particularly the fraud. AI has the capacity to detect fraud now. And we're using it in the department for that reason. We're using it for diagnostics. We're using it for paperwork. The agreement that I made yesterday with the pharmaceutical companies should cut off much more than that from paperwork from doctors. And so we're using it everywhere that we can, and we hope to drive it into the healthcare system in this country at every level, including the providers.
Right. Well, I think that there's no more powerful pulpit for evangelizing that than the post that you hold. And so I hope that you will help drive that, because it's not enough that just HHS uses AI to increase its productivity. We need to make sure we get this adopted within industry and within the provider community. And a follow-up question on that. I've talked to stakeholders across the industry about what they're doing to use AI, using AI to improve healthcare. There is a large level of frustration with organizations like CMS, and I don't think it's intentional. I just think it's a big bureaucracy and they're kind of hidebound, where someone comes up with a really revolutionary AI-based, I don't know, a diagnostic tool or a treatment option, but there just isn't accommodation in the system for it. There isn't a billing code, or there isn't a recognition that these can lead to cost savings. So, you know, we want to be good stewards of taxpayer money as well, but how can we change the rules to make sure that we're saving the money that we should be saving with AI?
We need people at Medicare, at Medicaid, and at CMS, leadership that is absolutely committed to this transformation. And we have that today. We have Dr. Oz, we have Chris Klump, and who came out of the tech arena and is now using his knowledge to transform what we do there. People send me every day of the week. People are sending me innovative ideas that sound wonderful, and we have a way to screen those now. I send them over to Chris Klump. I send them over to Clark Miner. We brought people in just to do AI and that kind of transformation. And those ideas are being explored one at a time, and the ones that work are being innovated, are being introduced and integrated into our system. So we're doing that today. You're going to see major changes over the next 4 years.
Right. Well, I'm very happy to hear that. I think it's going to require a partnership between the executive branch and us here in the legislative branch to make that possible. And if you haven't read the health section of our task force report, I'd encourage you to peruse that because we're going to need to work together to get this done. But thank you very much for your testimony.
Thank you, Congressman.
The gentleman yields. The chair now recognizes the gentleman from Louisiana, Representative Carter, for 5 minutes of questioning.
Thank you, Mr. Chairman. Secretary Kennedy, I want to ask you about how the department is gutting our federal investment in prevention and treatment of HIV. I'm perplexed why in April your administration shuttered nearly every unit in the CDC's Division of HIV Prevention and reassigned CDC's top HIV official, Dr. Jonathan Merman. Given that CDC has historically been the cornerstone of domestic HIV prevention efforts, do you know the percentage of all federal funding for HIV prevention provided by your agency, CDC?
Congressman, we don't intend to cut HIV treatment. We are, part of the reorg is reassigning HIV treatment.
But respectfully, sir, you have. It's not, the response to your answer to the question, what I'd like you to know, is it's 91% of all federal funding for HIV prevention, 91%. These cuts have been devastating for prevention of critical trials. You say you don't want to cut, but the reality is you have. Sir, in a second. According to a report in the American Association of Medical Colleges, AAMC, 160 active clinical trials associated with NIH overall were terminated in 2025, and more than 1/3 of those, 38%, investigating topics were related to HIV/AIDS. Mr. Chairman, I'd like to, with unanimous consent, enter into the record impact on NIH grant terminations that have been sanctioned and approved by this agency.
Without objection.
We have 27 HIV departments. We spend $7.5 billion a year, not $1 billion, $7.5 billion. Those are being consolidated and transferred to the
Respectfully, Mr.
Agency for
Secretary,
Healthy America.
Respectfully, Mr. Secretary, there have been cuts. We're not talking about consolidation. We're talking about cuts midstream, in the middle of research, in the middle of action. Cut. Let me be more specific, an example of what these cuts in HIV clinical trials mean. The Adolescent Trial Network for HIV Intervention, which supports studies of teenagers and young adults, received a stop work order that shut down research at 14 sites where 7 studies were being conducted. Were you aware of that, sir?
We have not,
Were you aware of that,
as far as I
sir?
know, we have not cut
Sir,
any clinical
Were
trials.
you aware of that, sir, respectfully?
As I said.
Were you aware, sir? Yes or no? Either you were or you
As
weren't.
far as I know, we haven't cut any clinical
But I'm telling you by your own records you are, so apparently that means you were not aware. Number
Well,
two,
a lot of
Mr.
things
Secretary,
that I've heard
were you
from
aware
this
that your
side-
department green-lighted these grants for termination? Did you make these decisions?
Like I said, as far a lot of the information that I've heard from this side of the aisle today has been untrue, mischaracterization.
Mr. Secretary, you're testifying that you are unaware who within the administration of your department made decisions to terminate research at 14 sites where 7 studies were being conducted. This is unacceptable, sir. Lastly, I'd like to bring your attention to termination of HIV vaccine studies. These cuts make up $258 million. Secretary Kennedy, did you make the decision to terminate these studies?
I didn't personally make that decision, but I understand.
You sanctioned them. How could you possibly justify such an action?
We've been studying been promising an HIV vaccine since 1984. And every year Congress pours money into it, and every year
because they haven't come up
every
with
year
what
it
you then
accomplishes
cut the
nothing.
forward motion by getting rid of NIH dollars that critically do research that save lives, and because it hasn't happened yet, well, we haven't.
me
Sir,
one
sir,
life.
it's my time. It's my time. So,
Show me
sir,
one
it's
life.
my time, sir.
Show me one
I
life.
can show you a whole lot of lives if you got a minute. I'm insulted that you would suggest that there aren't lives that have been lost. People are dying every day, sir. And for you to say, show me one, there are people all over this country that are suffering the loss of their loved ones. Sir, here's the reality. Here's a whole bunch of studies that I'd like to submit for unanimous consent to the record that will debunk many of the things that you're saying and will in fact prove that you aren't being forthright with us or the American people. May I, sir?
Without objection.
As we look and we listen and we see where we are, the challenge and the fear, sir, of the state of now and the arrogance and the unwillingness to be forthright with the American people. Mr. Secretary, your uncle, President John F. Kennedy, and your father, Senator Robert F. Kennedy, were towering champions for working Americans, for justice, for dignity, and for those without a voice. They fought to lift people up. So I'll ask this rhetorical question as I end.
The gentleman's time has
What
expired.
happened?
The
What
gentleman's
happened?
time has
What
expired. The
happened?
chair now
What happened?
recognizes the gentleman from New
I
York,
yield.
Mr. Langworthy, for 5 minutes of questioning.
Thank you very much, Mr. Chairman. Mr. Secretary, first, I'd just like to offer you a moment to respond to the outlandish claims that were put in front of you just now.
Yeah, as I said, we've got 27 HIDV divisions. Some of those were cut. Some of the studies that were not, where we poured billions of dollars in and they were yielding nothing, have been cut. We're looking for a real solution. And we're looking to do evidence-based, gold standard science. And we're going to do that, and we're going to do it to take care of the most desperate, most vulnerable Americans, including people of HIV. And there has been no withdrawal of any of that commitment.
Thank you very much, Mr. Secretary, and I appreciate your leadership and your vision and your efforts to make America healthy again. One area that's of particular importance to me in my district is newborn screening. And with changes to the Advisory Committee on Heritable Disorders in Newborns and Children, there's some uncertainty about the future of recommended uniform newborn screening panels. I'd love to hear what you're thinking about ensuring continued progress related to newborn screening and whether you see an opportunity for us to work together to strengthen and modernize this process.
Yeah, the program for newborn screening and the FACA, the Federal Advisory Committee, was started, I think, in 2019, or was set to expire in 2019. It was reauthorized every year since then. But over the last 2 years, it hasn't produced a single recommendation. We can do that from HRSA, and that's what we're going to do. We are working at HRSA to develop new indications that should be screened for, and we're going to continue to meet that obligation.
Thank you very much, Mr. Secretary. Now to supply chains. I want to bring to your attention a national security concern related to the shortage of nitrile gloves. Our nation depends almost entirely on imports in this area of nitrile gloves, with China supplying nearly half of that supply. Now, thanks to the previous administration, our current stockpile that the country holds is about a 10-day supply, and much of it is expired or near its expiration date. This means that if China decided to restrict our access to nitrile gloves tomorrow, it could cause serious disruptions to our healthcare system. Can we work together with this committee to address this ongoing vulnerability for our medical supply chain?
This is a vulnerability that we're very much aware of. There's questions about whether we can produce that particular item in this country. I've been traveling over the past couple of weeks to Argentina and to Ecuador, both of which have an interest in producing these products for the American market. It's a much more secure supply chain than relying on China. We're going to continue to offer incentives to develop these products here, but at the same time, we're going to explore our relationships with friendly nations who can produce them in their countries at a low price, low enough price for use, an ubiquitous item, and strengthen our supply chains.
Thank you very much. And also on the area of supply chains, trust in the FDA was shattered under the previous administration, and nowhere was that failure more clear than during the infant formula crisis. The Biden administration was totally asleep at the wheel while infants got sick, shelves went empty, and the American people got nothing but silence. Your budget includes $15 million to modernize infant formula oversight. Can you walk us through how that funding will be used and if the department is working on any other efforts to strengthen the infant formula supply chain?
It was one of our first priorities when I came into the department. We launched Operation Stork Speed to make sure that the quantity of infant formula that is available is enough to supply the demand, but also to improve the quality, to do everything that we can to recalibrate the formulas. We're doing that right now at FDA and at NIH. And we're working with manufacturers all over the country in Florida, Texas, and elsewhere to build up our supply chain so we never have a shortage again.
Well, thank you very much, Mr. Secretary, for your efforts there and for all that you're doing. I have 23 seconds if you want to respond to any of the other outrageous claims, because no one's let you get a word in edgewise over there.
I would love to be here for a conversation, and actually a lot of these issues are very complex. They don't lend themselves easy to sound bites. And I would love to have a conversation at some point with the Democrats about their concerns about these issues. I think our values are the same, but
the gentleman's time has expired. The chair now recognizes the gentleman from Ohio, Representative Landsman, for 5 minutes of questioning.
Thank you, Mr. Chair. Thank you, Mr. Secretary, for being here. You were talking earlier about maternal health, and I want to just come back to maternal health and the disparities that exist in this country, particularly between Black moms and everyone else. There is a bipartisan effort that emerged from this committee before I got here. Mr. Carter and others supported the Safe Motherhood and Infant Health Program. Now, this is an effort at HHS that focuses entirely on best practices, collecting data, trying to figure out what's working in terms of maternal health to improve healthy birth outcomes, et cetera. I think, I genuinely believe this was zeroed out either accidentally or by some sort of oversight, because obviously there's no waste, fraud, and abuse here. This is just the data collection associated with obviously a huge priority of yours, which is maternal health. So as we sort of go through this budget process, is this one area where you're willing to work with us to see if, in fact, we can restore funding for something that is saving the lives of mothers, helping to eliminate these disparities, and obviously improving birth outcomes across the country?
100%, and I'd love to operate on a bipartisan basis. If you contact my office, I'm happy to meet with you about it.
This is a program that came out of this committee. I don't know if it was unanimous, Mr. Carter, Mr. Chairman. I suspect it was, but it got zeroed out, so maybe okay. Number two, Head Start, because we're just on the trajectory, healthy birth outcome, brain development is happening at its fastest rate in those early years. And then we get Head Start, which has been a game changer for millions, tens of millions, something that your family has led on. It got zeroed out, but then the money got restored, which was good. And I'm just hoping that you can sort of assure everyone, because I'm getting calls on a regular basis from folks back home that they aren't sure if this is going to stick, if their Head Start funding is going to get pulled, and what that's going to mean for families and for children. Head Start funding is okay. That's not going to get touched.
Yeah, I mean, my uncle, Sarge Shriver, started Head Start. It takes care of 750,000 of the poorest kids in America. It not only takes care of those children and teaches them basic fundamental skills, but it also trains their parents on parenting skills. And the metrics for kids who graduate from those programs, in every metric, every indicia, are better. I'm very grateful to Roosevelt and OMB for meeting with me about that and then restoring the funding, and I will continue to protect that funding.
Thank you. Last one, NIOSH. I have a NIOSH office or facility in Cincinnati, one of the largest. As you know, NIOSH focuses entirely on worker safety. That's what they do. And we were able to work together to restore about 300 positions, mostly as it relates to firefighters and miners. There are still, I don't know, I guess 1,000 to 1,200 positions that are on the chopping block. Are you willing to sort of reconsider or work with us on the remaining positions at NIOSH, recognizing that some of the 10,000 FTEs were over, it was a mistake, right? Including the ones that were working on the National Firefighter Registry for Cancer, the World Trade Center Health Program, those kinds of things. the other folks at NIOSH and Cincinnati are doing exceptional work to keep workers safe. Are you willing to work with us on protecting those jobs too?
Absolutely. And if Congress funds it, I will, I'll keep the program open. So,
well, Congress did fund it. I mean, so it was funded.
this time around.
Yeah. So those jobs hopefully will get restored, or some of them?
I'm happy to meet with you about that.
All right. I have a few things to add to the record. I also would like to work on some of the rare disease stuff, but I'll include that in my what I submit. Thank you.
Thank you, Congressman.
Thank you.
The gentleman yields. The chair now recognizes the gentleman from Ohio, Representative Ruley, for 5 minutes of questioning.
Thank you, Chair. Secretary Kennedy, thank you for your work to make America healthy again. Thank you for the $10 million from NIH to fund long-term health studies related to the train derailment in East Palestine. During most of the year, it took Biden over a year to visit East Palestine. There were officials at all levels denying the potential for long-term health concerns. Newly released emails from the Biden FEMA show that they knew about the possibilities of long-term health concerns, but chose to keep the information from the public. The only way that we can know the potential health issues to be conducted by these studies is within the first 72 hours of the disaster that we had a baseline for health problems that would develop in the future. These are just not my constituents' concerns. These are my friends and neighbors. Because you see, I live within 20 minutes of the disaster site. Thank you to Senator J.D. Vance for standing alongside with us, never denying the possibility of health concerns in the future, and always fighting for more funding. This administration is showing what leadership really looks like. A welcome change. President Trump is committed to the gold standard science and has promised transparency with the HHS. So what I want to say to you is, when this first happened, local, state, and federal elected officials all gathered around East Palestine. And they basically said that there was nothing to see here and we could go back to normal and you didn't have to worry about the future. I was one of the few guys that said, I'm very worried about the future. I'm worried that when JD threw a rock into the creek that we saw chemicals. I'm really worried that the venom burn never needed to happen. I was there when Norfolk Southern convinced Governor Shapiro and Governor DeWine to do the venom burn. And now we have problems and we have possibilities of not only cancer that's developing right now with union workers that were on ground zero, cleaning up the site, but the future is so scary. So I am so curious because at the time you stood with us and you said we can't go back to normal. And now that you're in the position of the secretary, I would love to know what your overlook of this whole situation is. Thank you.
Yeah, thank you, Congressman. Following the burn, the crash in the burn, I visited East Palestine on multiple occasions. I met with families. I visited them in their homes. And even farther away than you live, I talked to the Amish farmers, the Mennonite farmers who had done the extraordinary, put generations of work into keeping their farms clean. And all of a sudden they were finding that they were risking dioxin and other deadly chemicals that were coming down in the fallout. We saw people immediately with illnesses, with respiratory problems, with gastrointestinal problems, with eye problems at the site. And I promised them I'd do everything I could to help them. This week, because of J.D. Vance's promise and my promise, we issued $10 million to NIH to go in and do honest science there from a government agency, and we're going to fully disclose whatever we find and let the chips fall where they may.
I appreciate that so much, Secretary. And let me give you the last 2 minutes of my time to go over any subject that was talked about during this committee or any thought process you would like to convey to the committee for the last minute and 45 seconds. Thank you.
Again, what I'd say is that, these are issues that are of concern to every American. One of the, a couple of the congresswomen congressmen, man and woman, have on the Democratic side have raised issues about ASIP. The ASIP committee that we fired was a committee that was rife with conflicts of interest with the pharmaceutical company. They had committed multiple acts of malpractice, including allowing now kids, when I was a kid, got 3 vaccines. Today, they get 69 to 92 jabs of 19 vaccines between conception and when they're 18 years old. And none of them have been safety tested with the exception of the COVID vaccine. It's the only one that had a pre-licensing safety trial. How can you mandate, which effectively is what they do, these products to healthy children without knowing the risk profile? So they know, they do efficacy studies and they show that it that it averts the disease. They don't do safety studies. And what we're going to do, the new ASIP panel, which has great scientists on them, none of them are anti-vax. The leading statistician alive in the world today, Martin Kulldorff, is the chair of that committee. The inventor of the mRNA vaccine, Robert Malone, is co-chairing the committee. We have scientists, immunologists, toxicologists, every kind of medical discipline that you would want on that committee, and we're going to have gold standard science now and good recommendations.
The gentleman's time has expired. The chair now recognizes the last member of the subcommittee, the gentleman from New Jersey, Representative Keene, for 5 minutes of questioning.
Thank you, Mr. Chairman. And I want to thank Secretary Kennedy for being here today. I am very interested in learning about the plans for restructuring and streamlining at HHS. I'm especially interested to hear how these changes will improve New Jersey's impressive biopharmaceutical industry. Right now, there are many innovators in my district who are developing treatments to diseases that currently have no treatments, or they are improving the quality of life of patients around the country by developing improvements to existing therapies. New Jersey's innovators should be proud of their work, and Congress and HHS should do everything that we can to enable this innovation to benefit patients. Secretary Kennedy, in your testimony, you discussed the changes happening across HHS, and I'm hopeful that your efforts can improve processes across your department's various agencies. I've heard from stakeholders in New Jersey about these changes, and they could impact the prescription drug approval process. Could you speak to how you are looking to ensure that these changes have no negative impact on drug application review and approval timelines, new guidance, or general FDA response times to drug sponsors?
Are you talking about the personnel changes?
Yes.
They're not going to have any impact. And we have met repeatedly with the biotech industry, including people from New Jersey, to assure them of that. We want to light a fire under biotech in this country, and that's exactly what we're going to do. It is the future of medicine. The stuff that is happening, the developments and innovations that are happening in that space should be exciting to all of humanity. And we're going to make sure that the United States remains the center of biotech, of the biotech revolution. China is putting huge amounts of money into this space, and it's important that we do the same thing. We're going to try to dismantle the barriers to biotech development and approval, and to make sure that we do everything that we can to support that industry.
Thank you. Second question, Secretary Kennedy. I appreciate your comments earlier on innovation and the role that cell and gene therapies play in that space. However, we must not forget the innovation that continues in the small molecule drug space, especially since these drugs can often be more convenient for patients. So amidst changes at FDA over the past several months, including at the Centers for Drug Evaluation and Research, how are you ensuring that FDA can continue to enable innovation and flexibility in its reviews and approval of small molecule drugs?
I mean, that is a delicate path that I think we all have to talk about. We have to work with Congress to reform the pill penalty, and there is a provision in that in the big beautiful bill. And it's something that Congress ultimately is going to decide. we want to make sure that, it's the small molecule drugs that you can take at home, the pills that the elderly consume in this country, and we want to make sure those are available and that those are at a convenient cost. And to some extent, the pill penalty has dampened innovation in that space, and a lot of the investment money has moved to the large molecules, the long molecule space. But it's a delicate balance, and we try to resolve that in the big beautiful bill. I think it's something that both sides of the aisle have an interest in, and that we all ought to be trying to strike the right balance.
I look forward to working with you in that regard, legislatively or administratively. Earlier this year, Secretary Kennedy, the administration issued an executive order that called for you and the FDA commissioner to look at administrative and legislative recommendations to improve the process by which prescription drugs can be reclassified as over-the-counter medications. This is commonly referred to as switch, and is important to me since New Jersey has a number of over-the-counter drug manufacturers. How can we work together to make sure that FDA approaches its work on OTC medicines, including switches, in a common sense and least burdensome manner to make sure that we realize the full potential of OTC benefits for American consumers?
This is an opportunity that we're deeply interested in, that we're committed to at FDA, and I would urge you to talk not just to me, but to Marty McCary about that. I think you'll be very, very gratified by by his openness to those kind of innovations.
The gentleman's
Thank you,
time
Mr.
has
Secretary,
expired.
and I yield back.
And the gentleman yields back. That concludes questions from the members of this subcommittee. I ask unanimous consent to insert in the record the documents included on the staff hearing documents list. Without objection, so ordered. I'd like to thank our witness again for being here today. Secretary Kennedy, thank you very much for your presence here. Members of this subcommittee and those who are present and waved on may have additional written questions for you. I'll remind members of this subcommittee and those who are present and waved on that they have 10 business days to submit questions for the record, and I ask the witness to respond to those questions promptly. Members of this subcommittee and those who are present and waved on should submit their questions by the close of business on Wednesday, July the 9th. Without objection, the subcommittee is adjourned.
Okay, ready to go?